Ladies and gentlemen, welcome to the series of seminar videos on Germanische Heilkunde by Dr. Rutgerd Hummer, MD. My name is Helmut Pilhar. I am the father of Olivia, and the lecturer appointed by Dr. Hummer for Germanische Heilkunde theory. This seminar video is about the first biological law of nature, also called the Iron Rule of Cancer, IRC. The Iron Rule of Cancer describes the monocausal cause of diseases. The cause of those diseases that arise by themselves. Cancer, allergy, chronic conditions and psychosis is monocausal, the biological conflict shock, the Dirkhammer syndrome, or also called the DHS. The DHS is the linchpin in Germanische Heilkunde. It is about biological conflicts, and not about psychological problems. The difference is clarified. The first biological law of nature is considered generally accepted. The objective is to learn to understand what is meant by a biological conflict. You will learn more about this in the approximately 2-hour seminar video. First biological natural law. Germanische Heilkunde, by Dr. Rutgerd Hummer, MD. Ohm's law from electrical engineering states that the resistance of a conductor is a constant, R equals U divided by I. Independent of voltage and current, provided the temperature remains the same. If now the voltage should change, then proportionally, the current must change. Mr. Georg Ohm was the first to prove this relationship between voltage and current. As a student of electrical engineering, I had to keep a record of this lawful dependence in the school laboratory, using an appropriately arranged electric circuit. And I had to do so in beautiful handwriting. Of course, all pupils could prove the correctness of Ohm's law from their own examination. One can even make predictions with Ohm's law. One knows that by a voltage change, the current must change proportionally to the constant of resistance. If one does not like to believe this, then one can recheck it with an appropriate arrangement, as we students did at that time. Note, like Ohm's law, every law of nature must be reproducible at any time, and it must allow predictions. As there are physical laws of nature, there are also biological laws of nature. That's why each of us has a father and a mother. This is not only true to 99% probability. But one always has a female and a male parent. Whether the fertilization took place naturally or artificially is irrelevant for this. A pregnant woman must have lain with a man. If she denies this, one knows that she fibs. A law of nature therefore needs no statistics. With statistics, we can be tricked. With laws of nature not. And to laws of nature, there can be no alternative or exception, because then there would have to be a second creation. A law of nature is an expression of the will of creation. The creation wants it this way, period. To be able to have therapeutic success, one must build on natural biological laws. If one acts against these natural biological laws, then one suffers. The first biological law of nature that Dr. Hummer was able to discover is also the most important, because it describes the cause of the disease. Everything in Germanische Heilkunde revolves around this biological conflict shock. This shock triggers a particular biological program in the individual, which has been firmly programmed by Mother Nature and is developmentally conditioned to help resolve this shock. This first biological law of nature is also called the Iron Rule of Cancer. This Iron Rule of Cancer can be reproduced at any time on the next best patient case. Scope. It can be said that the first biological law of nature describes the monocausal cause for those diseases that arise by themselves. That is for cancer, chronic diseases, allergies, psychoses. Monocausal means that these diseases have a single cause, precisely this biological conflict shock or Dirkhammer syndrome, DHS. This statement is scientific because it can be verified. Is this statement true or not true? Until now, it was thought that diseases had multifactorial causes. Such a statement is not scientific, because it is imprecise and leaves many loopholes open. When the woman suffering from breast cancer asks the oncologist what caused her to have this breast cancer, the oncologist usually answers, "Your breast cancer is genetic. Because your mother had breast cancer, you now also have breast cancer." If the patient then replies that her mother did not have breast cancer, and neither did her grandmother, the oncologist dodges the question and claims then it will probably have environmental or nutritional causes. We don't have time to look for causes. We must start your therapy immediately, or you will die. Letting a conventional physician settle on a cause of illness would be like trying to nail a pudding to the wall. It won't work. The laws of nature Dr. Hummer discovered have been examined countless times by medical boards and universities, and have always been confirmed to be correct. There is no refutation of the Germanische Heilkunde. In our society, a university is in the science business. It's the flagship. There is no higher authority. So Dr. Hummer has kept the rules of scientificity. The one that chickened out is conventional medicine. Conventional medicine must either acknowledge Dr. Hummer, or refute him. In conventional medicine, something is generally considered to be correct, until it has been disproved. This is why Germanische Heilkunde is considered real science. The causes of illness have nothing to do with nutrition, heredity, a bad sleeping place, or infection. Germanische Heilkunde does not apply to poisoning, injury, extreme malnutrition. About poisoning. So, if one is chronically poisoned and falls ill from it, there is no conflict to be solved here. But this poisoning must be stopped. Smoking is and remains a chronic poison, but it cannot cause lung cancer. In fact, there are no so-called carcinogenic substances. More about this in the chapter, Therapy. About injury. If you fall from a ladder and break your bone, you usually do not need to resolve any conflict. Your body immediately switches to healing, and the bone heals. In the case of a major injury, it is up to the emergency medicine of conventional medicine, and here they can achieve truly phenomenal things. By the way, a small cut heals inevitably. No matter if you change your diet, change your sleeping place or not. About malnutrition. In the case of extreme malnutrition, such as vitamin C deficiency of the seafarers and the resulting scurvy, there is likewise no need to resolve a conflict. Rather, this deficiency must be corrected. For example, with sauerkraut. The first thing the freshly diagnosed cancer patient often does is change his diet to healthy. Unfortunately, this approach misses the mark. Diet has nothing to do with cancer, and a change in diet does not make cancer disappear. Every individual has a nervous system. We possess an arbitrary nervous system, with which we can speak at will. And a voluntarily nervous system to move, stand up, walk, sit down, and so on. And we have an involuntary nervous system, which is responsible for the heartbeat, digestion, the movement of the intestines, for the widening and narrowing of the vessels, causing ice-cold hands, boiling hot hands. Try to give yourself ice-cold and then immediately boiling hot hands at will. You can see that this is not possible. This can only happen via the involuntary nervous system. This involuntary nervous system is also called the vegetative nervous system. From here on, we are only talking about this involuntary vegetative nervous system. Leave the voluntary nervous system entirely out of consideration from now on. Whether you want to suffer a conflict or not, whether you want to solve a conflict or not, all this goes completely past the awake mind. A biological conflict triggers our subconscious. Another example of control over the vegetative nervous system would be the widening and narrowing of the pupils. The advertising industry knows that a woman of childbearing age, at the sight of a baby, involuntarily widens her pupils. So it combines a washing machine offered for sale with a picture of a baby. This way, the washing machine product better gets into the customer's brain. Now a woman can decide 100 times to hold her pupils closed at any future sight of a baby. But it will not work. The widening and narrowing of the pupils is incumbent on the involuntary vegetative nervous system. And just so, all sensible biological special programs are controlled by the vegetative nervous system. Through the conflict, and later through the program tracks, our vegetative nervous system experiences an immediate abrupt change of direction, until the conflict resolution itself. However, one can control this involuntary nervous system willfully, if one proceeds causally and relative to the conflict. Let us now try to understand this connection between the vegetative nervous system and the disease. This involuntary vegetative nervous system originates from the spinal cord and innervates all organs. It has a stress aspect, which is also called sympathicus. And it has a rest aspect, which is also called parasympathicus or vagus. Thus, the body can switch the organs from stress to rest, and back again. There are also so-called ergotropic organs like the brain, the heart, and the skeletal muscles, innervated by the sympathetic nervous system. And there are so-called trophotropic organs, such as the digestive system, which are innervated by the vagus. The hunter and the prey. As the hunter hunts and the prey animal escapes, both are in stress and sympathicatonia. The brains are innervated. The hunter tries to anticipate the escape route of the prey animal, and the prey animal tries to trick the hunter. The hearts are innervated. They run at full speed for both, and also the blood pressure is increased for both. The skeletal muscles are innervated. Each tries to be faster than the other. Both have narrow blood vessels. Both have cold extremities. On the other hand, the digestive systems are not innervated. For both, digestion is at rest. Although the hunter and the prey animal are both sympathicatonic, there is nevertheless a huge difference between them, because the hunter caught the prey animal on the wrong foot. The hunter waylaid it. When the prey animal recognized this, for the prey animal it was highly acute and dramatic. An isolating feeling, catching the prey animal on the wrong foot. It was conflicted for the prey animal. And it started for him a sensible biological special program, that helps him solve this problem. And this was immediate, in that its involuntary nervous system switched instantly into sympathicatonia. The prey animal immediately took to its heels and mobilized all its forces. This is also known as the flight reflex. It's a sensible process, that makes survival possible. On the other hand, the hunter had already known for many days, that he would be hunting today. At this time of day and in this very clearing. Lying in wait, he saw the unsuspecting prey animal coming. Naturally, the hunter is excited, when the moment comes. His heart is pounding, and the closer the prey animal gets, the tenser he is. But the hunter didn't get caught on the wrong foot. So the hunter has no biological conflict and thus no special program going on. The poor prey animal has now been shot by the hunter, and prepared at the evening campfire. We all know the great fatigue that overcomes us after a substantial meal. This tiredness is a vagatonic symptom. The brain, heart and skeletal muscles become less and less innervated. One becomes tired. One has no more head for complicated arithmetic tasks and the like. One takes a digestive nap or goes to sleep entirely. Now the hunter's vegetative system switches to vagatonia, and innervates the intestine. Now the hunter is digesting. His musculature is no longer innervated during sleep. If you lift the arm of a sleeping person and let it fall out again, the arm falls limply. The vessels are switched to wide, and the body temperature is slightly increased. You know this yourself, dear student. If you go to bed later than your partner, and snuggle up to the one who has been sleeping for hours, you feel that your partner is downright hot. However, he is not sick. In the morning, the hunter is recovered and fit for the next hunt. The hunter went through the normal day-night rhythm. During the day, he was stressed, and at night he was vagatonic. The hunter was sympathicatonic without conflict, and the prey animal was sympathicatonic with a biological conflict. We want to discuss now more precisely what the latter means. The normal day-night rhythm. With the following graphic, called Hummer's Compass, we have compressed the most essential information of Germanische Heilkunde. From this graphic, we can derive or reconstruct every imaginable symptom. It's therefore very important to read this graphic, and to be able to interpret it correctly. This graphic represents every vegetative coordinate combination, in which we can find ourselves at any time of our life. No matter if it is day or night. No matter whether healthy, whether conflict active, whether in a healing phase, or just having become healthy again at the end of the healing phase. And whether just before, during, or after any conceivable crisis. In other words, this chart describes our current actual state. In our further consideration, we leave the voluntary nervous system entirely out of it. From now on, and in Germanische Heilkunde, fundamentally, it is only about the involuntary vegetative nervous system, which cannot be voluntarily controlled. But now, dear student, you will learn to understand how to willfully control the involuntary vegetative nervous system, and thus these special programs, like cancer, chronic diseases, allergies, and psychoses. On the x-axis, we have plotted time. So Monday, Tuesday or February, March, April, and so on. On the y-axis, we have plotted the intensity of the stress aspect. That is the sympathetic nervous system activity, toward the top, and downward the intensity of the resting aspect. That is the vagus, or vagatonic nervous system activity. In stress, the brain, the heart, and the musculature are innervated. And the digestive system is at rest. Conversely, in vagatonia, the digestive apparatus is innervated, and the ergotropic organs are at rest. If we are healthy, then the normal day-night rhythm is present. During the daytime one is sympathicatonic. One has to work or go hunting. One has constricted vessels and rather cool hands. At night we are vagatonic. Here the body draws new energies. Now we have wide vessels and warmer extremities. Let us now discuss the biological conflict shock. The first biological law of nature is also called the iron rule of cancer. Yet, it also applies to those diseases that one would not precisely call cancer, such as the common cold, paralysis, neurodermatitis, and so on. In other words, it applies to those diseases that arise by themselves. The iron rule of cancer has 3 criteria. The first criterion is: every sensible biological special program of nature, SBS, arises with the DHS, Dirkhammer syndrome. That is a very severe, highly acute dramatic, and isolating conflict experience shock, which catches us on the wrong foot, simultaneously on 3 levels. The psyche level, the brain level, and the organ level. The second criterion is: at the moment of the DHS, the biological conflict content determines both the localization of the SBS in the brain, as a so-called Hummer focus, and the localization in the organ. The third criterion is: the course of the SBS is synchronous on all 3 levels. Psyche, brain, organ. From the DHS through conflict resolution, conflictolysis, and epileptoid crisis, to renormalization of the day-night rhythm. What does this mean, and what do these terms mean? The sensible biological special program. As we will see later in the 5th biological law of nature, Mother Nature does nothing good or evil. She only does that which is meaningful. Since we are part of this nature, there can be nothing evil in our bodies. The biological sense of what is happening in our body can be understood when we try to understand the history of the development of humanity. In the end, everything is wonderfully ordered. It is not the symptom that one should be afraid of, but rather one should pay attention to the cause of the symptom. Before, in the long outdated conventional medicine, one knew almost nothing about the causes of diseases, except for a fracture of the leg, but these causes of disease we now understand by understanding of the first biological law of nature. The Dirkhammer syndrome? Dr. Hummer named this biological conflict shock, from which we must derive the therapy, after his deceased son. Dirkhammer syndrome, or DHS for short. It was because of the death of his son that he first observed the conflict shock as the cause of his subsequent cancer. The Hummer focus. The so-called Hummer's focus in the brain can be photographed with simple computer tomography, CT. This is conclusive proof that the disease is monocausal and has nothing to do with nutrition, sleeping place, infection, or heredity. For this reason, in its character assassination against Dr. Hummer, the deep state avoided mentioning, or even discussing, this Hummer's focus. The Hummer focus appears in the brain, and on the organ level during the conflict active phase. It has the shape of a shooting disc, and sharp rings, similar to the waves caused by a stone dropped into the water. Hummer's focus is always 3-dimensional. During the healing phase, edema is deposited and squeezed out by the crisis. At the end of the healing phase, the tissue also scars 3-dimensionally. We call all these manifestations Hummer focus. Whether it is cancer, chronic illness, allergies, or psychosis, the cause of all symptoms is always this biological conflict shock, the DHS. The first criterion states: every sensible biological special program of nature, SBS, originates with a DHS, Dirkhammer syndrome. That is, a very severe, highly acute dramatic and isolating conflict experience shock, which catches us on the wrong foot. Simultaneously on the 3 levels, psyche, Gehirn, organ. So we have to imagine this threefold course of conflict for the individual, each level separately and absolutely synchronous to the other two levels. This gives us an overdetermined diagnostic procedure in Germanische Heilkunde. If we know one level, we can draw conclusions about the other two, because there is no organ disease without a corresponding correlate in the psyche and brain. There is also no psychosis without a corresponding correlate on the organ and brain level. The individual is an inseparable unity. What does it mean for an experience to be highly acute dramatic, an isolating feeling, and caught on the wrong foot? When you ask a patient about his conflict, he often says, "I was struck as if by lightning. It hit me like a blow. It went through me. I fell into a deep hole. It was the worst experience. I was in shock." Such a highly acute dramatic experience affects you directly, and doesn't give a damn how important you are. If the neighbor's house burns down, you feel for the poor guy. But you are not affected. There is a biological conflict for the neighbor, but not for yourself. If a sack of rice falls over in China, it doesn't affect those in Europe in the least. On the other hand, the little Chinese boy who should have brought the sack of rice to his sick grandmother, he has suffered a biological conflict in this mishap. For someone in Europe, the event is trivial, but for the Chinese boy it is highly acute dramatic. If one is diagnosed with cancer during a routine checkup, this is highly acutely dramatic for the person concerned. He associates this diagnosis with imminent death, and reacts with lung nodules, which the conventional physician later misinterprets as metastasis. If on the other hand, one knows Germanische Heilkunde, one would firstly not expose oneself to this unnecessary danger of a cancer diagnosis by the conventional physician. Secondly, one would know that one can certainly do something about it, and that one does not necessarily have to die now. For the ignorant, the cancer diagnosis is highly acute and dramatic, and for the knowledgeable, it is half as bad. For the ignorant, there is a biological conflict. For the knowledgeable, there is not. Sneezing is the crisis of a scent conflict, concerning the nasal mucosa. A scent conflict means not being able to sense danger. A scent conflict can also be a sudden stench. It can also mean figuratively, that a situation stinks. Here's a personal case study of sneezing, that illustrates the aspect highly acute dramatic. I was driving my motorhome on a country road. On the opposite lane was a relatively dense column of vehicles, which progressed only slowly. Suddenly, a passenger car swerved out of this oncoming column and came toward me, in my lane. It accelerated powerfully, as could be clearly seen. What I hadn't seen was a gap in the opposing column, in which he quickly slipped in, just before coming to a collision with me. I got past, and nothing happened. Perhaps half a minute later, I had to sneeze once, but violently. So during this overtaking maneuver, which was unexpected for me, something had happened after all. I suffered a conflict in the process. For me, it was highly acute dramatic, because the situation was very dangerous. It was an isolating feeling for me, because no one could help me or save me in the process. And I got off on the wrong foot in the process. I didn't expect such a risky overtaking maneuver. If you are charged a horrendous amount of money and are poor, you find it highly dramatic. If, on the other hand, you are wealthy and receive the same amount, you can accept it calmly. A large wallet can prevent many conflicts. One man's wife runs away, and he reacts with a loss of territory conflict, and in the crisis with a heart attack. The other man who has lost his wife, claps his hands and is happy to be rid of her finally. What is highly acutely dramatic for the first, the second can laugh about. No, a customarily educated person would think that sneezing and cancer couldn't have an exact cause, yet they do. In both cases, the cause was a moment of shock, a DHS. Why it causes sneezing in one case and cancer in the other, I will explain later. What does the aspect, an isolating feeling mean? An isolating feeling means that, in this moment of shock, you were on your own. You could not communicate, or you could not break through your isolation. When one is taken by the hand a few minutes later, it is too late. The conflict has already happened. The Hummer focus in the brain has been created, and the tracks have been stored by the brain as well. Now a few examples, to clarify the aspect of the isolating feeling. Look with your mind's eye into the face of a small child, as a strange big black dog jumps up on him. The horror is written all over the child's face. If the child is without his mother and without protection, the child suffers a conflict. But if his mother is immediately on the spot, she can pick up her child, thus breaking through his isolation and appeasing the child. In both cases, the jumping up of the strange dog is highly acute dramatic for the child, and catches him on the wrong foot. In both cases, the child is frightened. But in the first case, a biological conflict arises. Because the child is alone in the face of the strange dog, and cannot break through his isolation. In the process, the child's brain also stores the big black dog track. Years later, when this child runs into a big black dog again, he suffers a recurrence of the original conflict, through this track. Then this child is chronically ill via the big black dog track. For example, in the form of an allergy. In the second case, however, the child is in the mother's arms and safe. This child is not alone, which means that the aspect of isolation is missing, and a biological conflict cannot occur. The mother's presence not only saves her child from conflict, but perhaps even from a lifelong allergy to dogs. In nature, a mother would never let her child out of her sight without distress. What we do to our children in these state-run educational institutions, separated from their mothers and supervised often by pedophile educators, borders on gross negligence. A boy in kindergarten fell and hit his mouth against the edge of a table. The accident was not particularly bad. The boy did not even bleed, but his lips were thickly swollen. At night the boy convulsed, holding his mouth with both hands. The way of his convulsing gives information about the motor conflict. In the case of this fall, the main reason for the conflict was that there was no comforting mother available for the child. What is being done to the elderly today, in the times of Corona? With the isolation and residential detention is a crime of loneliness. One can be caught isolated among thousands of people. As a speaker, you stand on the stage in front of the audience, and suddenly notice that the audience is whispering to each other under their hands and looking at you with a grin. Some time passes until you realize that your fly is wide open. At this moment, you would like to sink into the ground. Although hundreds of people are around you, you are still caught isolated by this event, and a conflict arises. You are thundering down the highway at 200 kilometers per hour with your partner, and suddenly you skid. You and your partner are stiff with shock. Can the partner, who is sitting right next to you in the car, break through your isolation? No. How could he? He himself is absolutely powerless in the wildly skidding car, and just as vulnerable as you are. If I want to cut off your head with a samurai sword, can you break through your isolation? I am standing in front of you, and you are not alone. No, you cannot break through your isolation, and a conflict arises in you. Naturally, singles have a more challenging time avoiding this isolating aspect. If one receives the news of the death of one's own child and can cope with the tragic event together in the arms of one's partner, a conflict can possibly be prevented for both parents. On the other hand, when such an event occurs, the single person does not have a familiar person at hand. It is also known that religious people are less likely to get cancer, and can survive it more easily than non-religious people. Suppose a highly acute dramatic, and completely unpredictable event happens. In that case, the believer always has his dear Jesus with him in his head, preventing him from this isolating aspect, which also prevents a conflict. So, the believer has only a psychological problem and does not become ill. Meanwhile, in this same event, the non-believer suffers a biological conflict. With this next testimonial, I think I can illustrate this isolation in the moment of the biological conflict shock, DHS, quite vividly. This was a frontal fear conflict with a so-called non-Hodgkin's lymphoma in the healing phase. The spook was over within 1 or 2 days, because I could solve the conflict relatively quickly. After a Hummer seminar in Spain, during which there had been a lot of talk about Masonic lodges and so on, I went out to dinner in the nearby town of Alhorn, with a group of seminar participants. We took a seat in a guest garden, which seamlessly merged with the adjacent sidewalk. I sat at the head end, with a view in the direction of the sidewalk. There I noticed a man of about 60 years, resting himself in the middle of the sidewalk and grinning maliciously at me. He must have been standing there for some time. Who was this man? At first, I thought he was someone who'd seen me in the media. Something similar had happened to me several times, and in various cities in Austria and Germany. I was often addressed on the open street as Olivia's father. But in Spain? In Spain, we hadn't been in the media that often. How did this man really know me? Then a lady came out of the restaurant and walked straight towards this man. Presumably, she had been in the toilet, and her husband was waiting for her. He pointed his head in my direction. She leaned shoulder to shoulder against him and also looked at me, full of malice. That's when it flashed through me. This must be the intelligence service. So they are looking and watching me. Instinctively, I wanted to draw the attention of my companions on the adjacent seats to this strange scene. But it was rumored at the seminar that both these two seminar participants sitting next to me could be Scientologists. Were they perhaps also informers of the Secret Service? I paused and abandoned my plan. A few moments later, this strange couple on the sidewalk continued on their way and disappeared. I did not talk about this incident with anyone. At night I dreamed precisely this scene. An unresolved conflict always returns in dreams. The following day I spoke to Dr. Hummer about this strange encounter the night before, and Dr. Hummer immediately declared his solidarity with me. Dr. Hummer was shadowed on record for many years, and in such a way that he had to notice it. With this, one can finish people off with nervous breakdowns. In any case, during this conversation with Dr. Hummer, I must have solved my frontal anxiety, because the following day, I developed a painful pharyngeal duct cyst, which became noticeable as a visible lump on the right side of my neck. The pain was similar to a sore throat muscle. The pharyngeal ducts are a remnant from evolutionary history when there were no lungs. They transport oxygen-poor blood to the gills and oxygen-rich blood away from the gills. Inside, these gill passages are lined with squamous epithelium, which ulcerates during the frontal fear conflict, increasing the cross-sectional diameter of the passage, which is the biological purpose of this particular program. Because the fish can now get more oxygenated blood transported through its gill passages, it can thus respond better to this frontal fear. In the healing phase, the squamous epithelium is repaired under swelling, which manifests itself as a pharyngeal duct cyst. In the past, conventional medicine thought it was a lymph node. When the mistake was noticed, they then called it non-lymphoid cancer. If you have a weakness for the name horse, you can call a cow a non-horse, right, dear fellow believers? I still remember Gerd slapping his hands on his thighs with laughter and saying that I was a delicate flower after all, and would be knocked down by a nasty look. Well, yes, it's true. I am certainly not the bravest. Now, however, my reference to the aspect isolating feeling. If at that time the companions seated beside me had been good friends of mine, then I could have broken through my isolation. And as a trio, we would have laughed at these two figures on the sidewalk, or would have asked them a few questions. Then I could have broken through my isolation and saved myself a conflict, including a pharyngeal duct cyst. What does the aspect caught on the wrong foot mean? Dr. Hummer illustrated the aspect of being caught on the wrong foot with this photo of a goalkeeper, who is indeed standing on the wrong foot and therefore has to watch helplessly as the ball, that was deflected shortly before, rolls into his goal. This goalkeeper stops every ball whose path he can foresee. But the goalkeeper hadn't reckoned that this ball would be deflected, and so the ball rolled easily into the goal. This photo also illustrates that it is not the force of the ball that matters. A ball that is coming straight can be stopped, even if it was shot sharply. On the other hand, the deflected and gently rolling ball can result in a goal. In other words, a bad event, for example, the doctor's announcement of the impending death of the beloved but very old grandmother, can pass without conflict, because one was not unprepared. One saw her death coming, and therefore it did not catch one on the wrong foot. On the other hand, the side remark of the partner, which he uttered completely inappropriately at a wrong moment, can lead to conflict. Precisely because one had not expected it. This side remark of the partner can be in relation to the death of the beloved grandmother, a trifle. Nevertheless, this side note leads to a conflict, and the death of grandma does not. This picture with the goalkeeper also shows that it is not 100 shots on goal that make the goal, but the one time of being caught on the wrong foot. So it is not constant stress that makes us ill, as psychosomatics wrongly believe, but the conflictive moment of shock. I can rush from appointment to appointment in my motorhome, under time pressure and with a lot of stress on the road. But I enjoy my job and make a living from it. Why should I get sick from this everyday professional stress? I won't. But when I get a phone call saying that my child has had an accident, bang! Then I have a conflict. Many newcomers to Germanische Heilkunde have a problem distinguishing between a biological conflict and a psychological problem. In the case of a biological conflict, these three aspects are always fulfilled. First, the experience is highly acute dramatic. Second, the experience creates an isolating feeling. Third, the experience catches one on the wrong foot. With a psychological problem, at least one of these three aspects is missing. A psychological problem like the imminent death of the beloved grandmother, for example, does not start a sensible biological special program, and cannot make someone ill. A biological conflict, on the other hand, inevitably does. Therefore, if there is any symptom, then there must have been a biological conflict. If there is a pimple on the cheek, a corresponding defilement conflict must have happened, which could also be resolved, because the pimple is in the healing phase. If a woman is pregnant, then she must have lain with a man. Once you have seen through this principle, it becomes easier in the sequel. Later, on the topic of therapy, we will see that it is essential to have found the conflict, because the therapy must derive from this conflict. In the conversation with the patient, the therapist must be able to find this moment of shock. The patient himself is primarily unaware of Germanische Heilkunde, and does not yet really know where the bells hang. When he finally does describe his conflict, the patient often attaches less importance to the highly acute dramatic aspect. Perhaps also out of shame, and tries to play it down. He also often plays down the aspect of perceived isolation, because he does not want to expose himself. On the other hand, the aspect of having been caught on the wrong foot, compared to the other two aspects, is almost neutral and unsuspicious in the patient's eyes. He openly admits that he really did not expect it. Tracks. How can a shock moment lead to a multi-year condition? Everything that runs chronically runs over tracks, beginning at the moment of the DHS. Because in this moment of shock, not only does the Hummer focus develop, but at this moment, our brain makes a snap like a camera, and all accompanying circumstances are stored as so-called tracks. No matter if you call it cancer, allergy, chronic disease, or psychosis, there are these symptoms only because of these tracks. The tracks are part of the biological conflict, which is why they cause the recurrences. Because understanding the tracks is so important, I will discuss them in a separate, detailed chapter. The conflict active phase. General. The biological conflict, the Dirk-Hummer syndrome, is a matter of a moment, of a conflicting moment in the person's life. And thus often, there is a famous search for the needle in the haystack. As long as one does not know this DHS, one does not know the cause of the symptom, and thus cannot proceed causally. The therapist knows from the organ level of the patient, from his handedness and his hormonal situation, which type of conflict has to be searched for. However, only the patient himself can reveal his own personal conflict. Every conflict is as individual as the human being himself. There are no two conflicts that are the same. From the DHS on, the tracks maintain this conflict or cause recurrences. Everything that is chronic goes through these tracks, that were programmed in at the conflict. These tracks are also absolutely individual. From the DHS on, the so-called conflict load builds up. The conflict load is the product of the conflict intensity and the conflict duration. It's represented by the area under the curve, in the conflict active phase. In Germanische Heilkunde, we color this conflict load area blue. The blue area will then correspond approximately in size to the red area of the healing phase. In the active phase, you draw on your reserves of strength, and in the healing phase, you gather your strength again. There are conflicts which one solves immediately, a conflict load of seconds or minutes. Then the healing phase will also take approximately seconds or minutes. Whether it was an anger conflict with colon cancer, a care conflict with breast cancer, or a loss of territory conflict with a heart attack or the like, it makes no difference. Conflict loads of minutes result in healing phases of minutes and are not noticed at all. On the other hand, if one was conflict active for a day, then one will be vagatonic, tired, and limp for a day. If you spend a whole week in conflict, you would not be able to get by with one day's rest, but would need a week to really get fit again. For this very reason, it would be therapeutically nonsensical to want to shorten healing phases by whatever means. This would deprive the patient of recovery. Besides, you cannot shorten healing phases. Such a plan would be nonsensical. With a healing phase of 1 week, one speaks nowadays of the flu. With a conflict load of several months, one has then a worse diagnosis, such as cancer, MS, diabetes, or the like. We have the crises around the middle of the healing phase. Its task is to steer the individual, falling into vagatonia, back towards health. The intensity and duration of such a crisis also depends on the preceding load of conflict. Many crises are not noticeable, because the conflict could be solved in a relatively short time. Each special program has its own typical crisis, and all crises run sympathicotonically with constriction of the vessels, cold sweat, and centralization. The sympathicotonia. The most prominent symptom on the organ level right after the biological conflict shock, DHS, is that the affected person immediately gets ice-cold hands. With the conflict shock, our autonomic nervous system instantly switches to sympathicotonia. This happens inevitably and bypasses our minds. Before we come to think, this DHS has already happened. Now the brain innervates the ergotropic organs. The blood pressure rises, the heart begins to throb, the musculature is tense, the vessels are set to narrow. Typical loss of appetite. If the patient had just been eating during the conflict, he hardly brings the bite down. Due to his sustained sympathicotonia, his digestive system remains at rest, and he hardly feels any appetite. If the conflict lasts longer, the patient noticeably loses weight. He may become emaciated, and he may even die of cachexia. Typical difficulties in falling asleep and staying asleep. From the DHS on, one is in sustained sympathicotonia, which is why it is difficult to get into a vagatonic sleep. One tosses and turns in bed, because one's thoughts do not come to rest. When one finally does sleep, one often dreams of one's conflict. The brain searches for a solution to the conflict, even while asleep. The level of the psyche, change of character. On the level of the psyche, the affected person immediately has obsessive thinking from the conflict. All thoughts revolve around the problem. The brain seeks a solution to this conflict. A minute before, one could chat with the affected person about trivial things, without any constraints. But suddenly this is no longer possible. Every conflict changes the nature of the person affected. Depending on the nature of the conflict, he might even be psychotic now. The change of nature towards homosexuality. Homosexuality cannot be inherited, because homosexuals don't reproduce. In reality, it is caused by conflict. In the right-handed man, a loss of territory conflict in the right male territorial area of the cerebral cortex is enough, and he becomes feminine or even gay. As a gay man, he thinks his homosexuality comes from his innermost being. He thinks that he thinks. But in reality, he is thought by his conflicts. The change of essence towards manic-depressive. The left-handed woman becomes calm and depressed during her first sexual conflict. For her, from now on, the world is gray and gray. The left-handed man becomes manic with his first territorial conflict. For him, the world is sky blue and rose red. And he makes everything exaggeratedly happy. These character changes are particularly striking in the so-called schizophrenic constellations, which we will discuss in more detail in the chapter on psychoses. Repression of the active conflict. A conflict hurts mentally and is therefore repressed by the person who has it. This repression is a sensible process in itself, because it allows the intensity of the conflict to be transformed and made livable. An approximately 40-year-old single woman came to Dr. Hummer, because of her Huntington's chorea, also called St. Vitus dance. Her grandmother and her father had this supposed hereditary disease in her family, but it is not hereditary. The cause of Huntington's disease is a motor conflict, over tracts in a hanging healing. And this conflict exists in every patient with Huntington's disease. It has nothing to do with heredity. In the brain CT of this patient, Dr. Hummer saw that she must also have suffered a sexual conflict in the process. She was with Dr. Hummer in Spain for 2 weeks. And every day, he asked her to tell him about her sexual conflict. Finally she said, "Gerd, if I knew the conflict, I would tell you. I don't know it." With the best will in the world, she would not and could not think of the conflict. On her last day in Spain, she studied a few case studies in Dr. Hummer's literature, and suddenly, the conflict came to her. She was 10 years old and alone at home, when a guest worker came to repair something in the garden. In the kitchen, the man attacked the girl, strangled and raped her and threatened to kill her if she told anyone. During this rape, she suffered her sexual conflict and, at the same time, also the motor conflict in both arms of not being able to fend off this pedophilic perpetrator of violence. So, she reacted with two conflicts at this rape. And only the cranial CT revealed, via the detour of her sexual conflict, the true reason for her St. Vitus dance. The track for her chronic symptom was the perpetrator himself. The perpetrator lives in her parents' neighborhood, to this day. How was she supposed to cope with it, as a child back then? If she talked about it, she would be killed by the perpetrator. So she repressed this event. But the unconscious is wide awake and cannot be erased by repression. The track, that was now responsible for the chronic course of her motor conflict, was any further sexual contact with men, who were primarily rough in bed. Unconsciously, this always reminded her of her rape from the neighbor. Dr. Hummer's advice was to find an empathetic man and start a family with him, so that she could finally get over her abuse. So the patient had indeed completely repressed her rape, and needed 14 days of repeated specific advice, to be able to find her conflict at all. And the cause of her Huntington's disease was not heredity, but a conflictual rape, 30 years ago. Often the tears flow. If you now speak to an affected person about his active conflict, his facial expressions change. His eyes become moist, his voice begins to tremble, and tears often flow. At one lecture, a man about 70 years old, a true giant in stature, asked me what could be the cause of his prostate complaints. When I told him the cause was an ugly semi-genital conflict, tears welled up in his eyes, and with the phrase, "My son is gay," he turned away, bowed, and left. The dream that keeps coming. If Dr. Hummer could not quite find the conflict in the patient, he asked the patient about recurring dreams. A recurring dream indicates an unresolved conflict. By the way, the ancient Greeks also asked their patients in the dormitories, the hospitals of that time, about such recurring dreams, to be able to deduce the cause of their illness. A gypsy girl, about 16 years old, fought with a rival for a boy. In the process, the two girls used real, sharp knives. During the fight, this gypsy girl suffered a motor conflict, and from that on had epilepsy. She had a recurring dream about various war events from this fight on. Again and again, she dreamed of war. When rival girls go at each other with knives, it's like war. These dreams were the track for her motor conflict. In a dream, you are also alive, and you experience the dream absolutely like real life. When she went to Dr. Hummer 2 years later, because of her epilepsy, both the boy and the rival had become irrelevant by then. Now, when the young woman became aware of her conflict, she could laugh about it. Which definitely solved her conflict and her dreams, and also her epilepsy disappeared. One overreacts emotionally. The person affected can also overreact emotionally, when facing his active conflict. As an example of this, I have an impressive case with a washing compulsion. After a lecture we were still sitting together with a beer, in a small group. The wife of a man, about 50 years old, complained about his washing compulsion. He would not grab a door handle with his hand, but would instead open it with his elbow. With doors that open inward, her husband would wait until someone opened the door from the outside, so he could slip out quickly. When she'd come home from out of town, she had to first wash her hands, before even touching her husband. He would protest that. After all, there are people who don't wash their hands after going to the bathroom. And he couldn't know if his wife hadn't touched a dirty doorknob. The cause of a washing compulsion is an extra-large schizophrenic territorial constellation plus an olfactory conflict. This 50-year-old man was willowy and manic, which suggested a territorial constellation. So I said to him, that he must have suffered an olfactory conflict. Suddenly, this 50-year-old sat bolt upright in his chair, raised both his arms and shouted, "The ether!" At about age 7, he was anesthetized with ether, before having an appendectomy. I still have that stench in my nose today. He continued loudly. All around people were downright frightened by his reaction, myself included. About a year later, a good friend of this 50-year-old told me that his washing compulsion had disappeared, and that his behavior had become somewhat more regular, in other ways too. For example, he used to be too ashamed to pee against a tree in front of his friends, but now that had become normalized. The patient was apparently able to resolve his conflict when he realized that nowadays anesthesia is no longer administered with ether. Since the events of that time could no longer be repeated, his conflict was therefore now irrelevant. The patient knew himself from back then, and he knows himself today. Thus, he recognizes the difference. At that time it was conflictive, and today it cannot happen anymore. As a result, this nerve connection in the brain is loosened, or other nerve connections are made, and poof! The symptom is gone. Often the affected person has never talked about his conflict before. If you ask the person about his conflict, he often confesses that he has not yet talked about it with anyone. This is a clear indication that this is precisely the conflict. Here is another excellent testimonial. Two men on a cure get to know each other. One of them knows Germanische Heilkunde quite well, and the other one goes by the name Sepp. Sepp is on this cure because of his burnout and his heart problems. Now, I have to dig deep into the chapter psychoses. A depression arises in the territorial area of the brain. In the case of the man, there must have been a territorial conflict for this so-called depression to be present. And the scale must drop to the right. If he has a territorial area conflict in the right territorial area in the coronary artery relay, then he also has increased angina pectoris. In children, the symptom resulting from this territorial constellation is called attention deficit disorder. In adults, it is called depression, and in 60-year-olds, it is called burnout. But it is all the same. Now, this friend knew that Sepp had an emphasis on his loss of territory conflict, on the right side of his brain. The friend thought about it and asked specifically what his wife had said. Sepp asks listlessly back, "What my wife said?" She had said nothing. They'd been married for over 35 years. His wife had said nothing special. The friend continued to think about where else they had their territory and asked what Sepp's boss had said. Suddenly, as if someone had pressed a button on Sepp, he started talking. Quote, "Our company, where I have been employed for 35 years, recently filed for insolvency. I work there as a foreman, and have had the greatest job in the world so far. But now, this insolvency is weighing heavily on my mind. So much, so that one day, when I saw my boss, whom I have known for so long, and who is actually a good friend of mine, walking across the yard. I asked him about the insolvency. But he reacted very angrily and barked at me. What I was doing, asking him such questions. He, who had fed me for 35 years. I was thunderstruck, standing in the yard, shaking and vibrating. Now, whenever I see the boss walking across the yard or meet the boss, my hair stands on end. I break out in a sweat, my heart races, and I start to tremble and shake. And now, you come along and ask me what my boss said? How did you know that? I didn't tell any of the doctors about the incident, not even here in the clinic. Because I always thought I'd be laughed at, or told not to be like that because of this trifle. But this was not a trifle for me. The nature of the questions to Sepp shows that this friend was well versed in Germanische Heilkunde. The woman and the workplace are of course part of the man's territory. As I said, we can interpret the organ level. If we now see this symptom in the other person, here, burnout and heart complaints, then we know what must have happened to him on the level of the psyche. Of course, it is an art to ask the right questions. For this, the questioner must have a few case studies for each possible conflict ready in his head. But it's also great fun to hit the nail on the head with the other person, so that the other person is completely taken aback and asks, "How do you know that?" When you, dear student, succeed in hitting the nail on the head for the first time, you will be amazed by the exactness of the Germanische Heilkunde. I promise you. Finding the conflict is one pair of shoes. The other pair of shoes would be to be able to propose a very individual solution for this personal conflict. For this, in addition to empathy, the therapist also needs wisdom. We will discuss more about this in the chapter on therapy. So, Sepp, out of shame, had not talked to anyone before about the actual cause of his burnout and heart trouble. His loud complaint about his conflict also showed that it was still highly active and not resolved. The level of the brain. In the brain, starting from the DHS, the Hummer focus is immediately visible in the shape of a bullseye, or target configuration. And it can be photographed, using computer tomography, CT. This Hummer focus in the brain is proof that all diseases that arise by themselves are monocausal, and that their cause is this biological conflict. For the conflict active phase, the Hummer focus remains target-shaped. The Hummer focus is a three-dimensional structure. However, the brain relay, that is the area of the brain in which this Hummer focus is located, does not undergo any change in volume as a result. With the resolution of the conflict, at least up to the moment of crisis, that is, edema is deposited in the brain in the so-called exudative phases. This is now a space-demanding process, and is called a brain tumor in conventional medicine. Mind you, it is not a division of nerve cells, because nerve cells can no longer divide after birth. Rather, one has to imagine this edema storage like a sponge, absorbing a drop of water. In this exudative phase, these sharp rings of Hamer's foci are lost, and the brain relay darkens in the brain CT. A strongly sympathicotonic crisis, about midway through the otherwise vagatonic healing phase, stops this edema buildup in the brain. The PP phase begins and the previously stored edema water is excreted. After the crisis, the brain relay stores glia. Glia is a special connective tissue that exists only on the nerves. At the end of the healing phase, the Hummer focus remains scarred for life, similar to how scars at the organ level can remain visible for a lifetime. The patient is now completely healthy again. The location of the Hummer's focus in the brain is determined by the conflict content, and the individual's handedness, and current hormonal state. The conflict content, associated at the moment of DHS, must be understood from the history of development. Only when the history of development is understood, can the biological meaning of these many different and diverse special programs be revealed. Depending on the germ layer, the biological sense is either immediately in the active phase, or at the end of the healing phase. In any case, the now started SBS helps completely and purposefully to solve the cause of the DHS. I'll refer to the chapter Hummer Focus, where we will discuss everything in more detail, and vividly with several pictures. The level of the organ. We must also think of the individual as an indivisible unity, of organ level and soul level, psyche. Precisely as the term individual means. Only when organ and soul are not separated, the individual is alive. At death, these two levels separate and dissolve. We in Germanische Heilkunde have a third level to reference. The level of the brain, because of the Hummer focus. If the conflict is active for the individual, the Hummer focus is sharp. Suppose the individual was able to resolve his conflict. In that case, this Hummer focus change is due to the formation of edema. And it looks different again at the end of the healing phase. Scarred and permanently so. Note: the biological conflict thus strikes at all three levels simultaneously. From the moment of the DHS, on the organ level we have either a cell change, cell proliferation or cell loss, or a functional failure. The functional failures, Dr. Hummer calls cancer-like diseases. While the cell changes, Dr. Hummer calls cancer. According to Dr. Hummer, a cold would be cancer. Because in the active phase ulcers develop in the nasal mucosa. That is, there is cell change. Diabetes, on the other hand, according to Dr. Hummer's classification, is one of the cancer-like diseases. In functional failures, there is still an active phase, a healing phase and a crisis. As in all other special programs. There is just no cell proliferation or cell loss. In diabetes, the alpha islet cells simply stop producing insulin. Cell proliferation is present from the DHS onward, in the old brain, brainstem and cerebellum, controlled programs. Thus, from the moment of the DHS, a colon cancer, endoderm, or breast cancer, old mesoderm, becomes larger and larger. In the new brain, cerebral medulla and cerebral cortex, controlled programs, from the DHS onwards, there is cellular atrophy. Thus, from the DHS, an osteolysis in bone, new mesoderm, or a gastric ulcer, endoderm becomes larger and larger. The functional failures are all controlled by the cerebral cortex. From the DHS on, the alpha islet cells stop functioning more and more in diabetes. I refer you to chapter, 3rd Natural Biological Law. All the behaviors of the different groups just described will remain until the biological conflict is resolved. With the conflict resolution, the cell proliferation of the old brain-controlled SBSs and the cell loss of the new brain-controlled SBSs stops immediately. With conflict resolution, the loss of function also stops immediately, and the function returns in the healing phase. Old brain-controlled tumors are tuberculously degraded by the associated microbes, fungi, fungal bacteria, beginning at the moment of conflict resolution. The new brain-controlled holes are refilled by the associated microbes, bacteria and possibly viruses, at the moment of conflict resolution. Here I refer you to Chapter 4th Biological Natural Law. On the organ level. For a cell change or a function loss with conventional diagnostic procedures to be determined, days and weeks must first pass. In the brain, however, we can diagnose an SBS immediately after it has started. Here's an example of this. A young woman who had gotten into a psychosis due to a love affair with her writing instructor came to Dr. Hummer. In her brain CT, Dr. Hummer saw that in addition to the territorial conflicts that were responsible for her psychosis, she had also suffered a territorial conflict with breast cancer, because of this writing instructor. The patient had not been able to detect any change in her breast at this point. Weeks later, however, she palpated her lump, and the orthodox physicians diagnosed it as breast cancer. The conflict resolution. At the level of the psyche. We all have suffered and resolved biological conflicts, several times in our lives so far. Who has never been ill? Often, during the course of a special program, it is the vagatonic healing phase with its symptoms, such as fever and listlessness. That is first noticed, and often immediately after the conflict has been resolved. Of course, the various crises in the middle of the healing phase are also noticeable. These should always be a reason for joy. After all, one has been able to resolve a conflict. The active symptoms in the various special programs are usually less noticeable, or only after a more extended period of conflict. If one solves such a conflict, then the famous weight is lifted off one's soul. This relief inevitably leads one into the inevitable vagatonic healing phase, and in a few moments, one suddenly has warm hands. By the way, a conflict is resolved just as inevitably as one cannot help but suffer a biological conflict when the three aspects, highly acute dramatic, an isolating feeling, and being caught on the wrong foot, are met. But if the conflict load is large, conflict resolution can be dangerous. In such a case, one should not look for the conflict at all. Besides, there is a high probability that in the meantime, this conflict has become irrelevant for the person concerned. If the affected person realizes he has such a conflict, he may inadvertently resolve his conflict, and thus enter a healing phase that he cannot survive. The therapist must know what he is doing. The patient has nothing to gain from the therapist patting himself on the back for having found the conflict. So beware of those therapists who only muddle around on the level of the psyche and leave out the level of the organs. A Germanische Heilkunde therapist must be a clinician. Be able to laugh about it. If the conflict has been resolved, then it can be laughed about. Being able to laugh about it, it is also an unmistakable indication that this conflict has indeed been resolved. This would not have been possible before. Here's a small example. I am a leisurely driver when I'm by myself. Speeding or risky driving is not my style, which is why I always allow for a large enough time cushion on my speaking tours. One evening I was chauffeuring a friend home on a winding road. A Sunday driver drove in front of me and, unexpectedly for my friend, I put on my blinker, swerved, and gave it a good throttle. Out of the corner of my eye, I noticed my friend clutching the back of the passenger seat with both hands and tensing up. I overtook this Sunday driver, rejoined my lane, and normalized my driving speed. As expected, my poor passenger relaxed noticeably. Suddenly he sneezed violently. I spoke to him about his sneezing and explained to him that he had suffered a scent conflict concerning the nasal mucosa during my overtaking maneuver, and had now been able to resolve it. The sneezing would have been the crisis of this special program. He listened to me, nodded, and laughed. Yes, that was precisely what he had felt during the overtaking maneuver. A shock. Highly acutely dramatic, Pilhar has gone crazy. An isolating feeling, no one will help me now. Caught on the wrong foot, Pilhar accelerated so suddenly. Its associated conflict content concerning the nasal mucosa. Not being able to sniff. What happens now? In this moment of shock, he did not feel like laughing at all. But now that everything had gone well, he could laugh again about the conflict he had just suffered. Pay attention to your own sneezing when driving a car. Dangerous situations very often occur while driving, which lead precisely to this scent conflict. This exercise will teach you to understand what a biological conflict is and what conflict resolution is. You will learn to understand the content of the conflict correctly. And you can also experience the various symptoms, as described in Hummer's books, on your own body. This turns the belief that this is so, into knowledge that this is so. And with the knowledge of these biological connections, you lose your fear. A sneeze is an absolute beginner special. It is harmless and often fun. Most of the time, the conflict is also timely. The conflict event that happened a few seconds or minutes ago is still well remembered. And you can learn about conflicts not only concerning oneself, but the conflict is often observable for others. Sometimes all others present can easily recognize the shock. One day I was sitting in the garden with my seminar group. A wife accidentally tipped a glass of water into her husband's lap. She was very uncomfortable, and quickly repaired the damage done. When all was well again, she sat down and sneezed. All those present were students of Germanische Heilkunde, and all of them had witnessed this special program live. Can you protect yourself from a biological conflict? It is difficult to do so. How can you protect yourself from an event that you do not expect? Testimonial, greasy kiss, pimples. The pimple is the healing phase of a sensible biological special program of the dermis. The dermis was developed by Mother Nature, so that our ancestor could protect his body from sharp stones, in that epoch when he left the sea and conquered the land. Accordingly, the conflict content for the dermis program is a violation of integrity, such as attack, defacement, or defilement. The associated brain is the cerebellum. The dermis makes cell proliferation in the active phase, which appears as melanoma when the conflict load is larger. If the conflict can be solved, the cell division stops. And fungal bacteria decompose the now no longer needed excess cells in a casse-eating, necrotizing manner. In the case of a smaller conflict load, a pimple is then present, which can be squeezed. This also stinks of carrion, as does every tuberculous healing phase. At the end of the healing, a small scarring remains. A woman is sitting with her family in a restaurant, and her uncle is eating greasy fish. While eating, this uncle is just talking. Lost in thought, she looks at his mouth with his greasy lips. While he is chatting away, she can see the white pieces of the greasy fish in his mouth. Then, suddenly the uncle gets this wave of love toward his niece, grabs her, and presses a kiss on her cheek. Just like that, she has his fat fish lips on her cheek. This was her defilement. Highly acute, dramatic, an isolating feeling, and catching her on the wrong foot. She surreptitiously wipes herself. The next day, she has a pimple on the part of her cheek he kissed. Now, take note. There is no pimple without a corresponding conflict. Back to the question then, how do you want to protect yourself from such an event? There is a euphoric atmosphere in the group, and suddenly you have the fish lips on your cheek. To protect oneself from something like that is not possible. What is the situation with primitive peoples? What we can do, however, can be seen in the few indigenous peoples that still exist. These primitive peoples are famous for hardly ever suffering from cancer, cardiovascular diseases, or allergies. For example, the Hunza people in the Himalayas were known for the old age they could reach in good health. At 3,000 meters above sea level, the 80-year-olds played bare-chested volleyball at an outside temperature of 8 degrees Celsius. For us civilized people, this is almost unimaginable. Civilization's diseases were unknown in the Hunza people, until their so-called civilization by the Chinese. Since then, it's been over with their health. A study of the University of Heidelberg reports that the Hunza people could become so old because they ate so much sheep cheese. Nonsense. To bring two facts in correlation is a popular trick of the old conventional medicine. Sugar and caries, smoking and lung cancer, sun and melanoma, and so on. And yet, even with watered-down statistics, no such correlation can be found in any particular individual case. Because this approach to understanding has nothing to do with science. On the other hand, In Germanische Heilkunde, we have 3 always synchronous facts that allow us to make predictions. Laws of nature do not need statistics. Mother Nature does not play dice. Now, in our Western world, we supposedly have the best medicine, which is becoming more and more expensive. At the same time, however, we humans are getting sicker and sicker. How is this connected? Dr. Hummer coined the phrase, "We are not living appropriately to our natural species code." If you lock up a wild animal, you can give it the best food, the best air-conditioned cage. And still, the animal gets sick, does not reproduce, and dies. It is forced to live against its biology. This animal must be released back into the wild, so that it can become healthy. And here we can start. Our society forces us more and more to live against our biological code. From early in the morning until late at night, we are on a treadmill in pursuit of money. In my childhood, it was still normal for the father to be able to support his family as the sole breadwinner. Today, the mother has to earn additional money, and the children grow up under outside care. The state can now tax the woman as well as the man, and get her children into its care. But conflicts are pre-programmed here, because neither the mother nor the child possesses a biological program to be separated from each other. In nature, separation from the mother would be certain death for a child. The newborn comes into the world with millions of years old biological programs. When it cries, it expects to be satisfied. It expects physical contact with its mother. It expects to be lifted and carried around. The infant needs its mother in its immediate vicinity, around the clock. But today, we live more and more against our biology, and that is the cause of these diseases of civilization. The single lifestyle is not the best thing for us either. To be shunted off into homes in old age is also inhumane, and does not correspond to our nature. As Dr. Hummer calls it, we humans become visibly lonely in the civilization scrap society, and that is against our biology. Our current biology would correspond much more to the tribal and clan community, or the village community, where everyone knows everyone, and where you can leave the front door unlocked. Where you go to the field together, and organize celebrations together. As a human being, you can only be fulfilled and happy in togetherness with your clan. We are happy when our neighbor is happy. When he is happy, we are happy. But all this has been destroyed. We suffer from it, and therefore we are chronically ill, like the poor animals on the factory farm. Free, primitive peoples do not know this biological nonsense, and are therefore happier and healthier than we are in our oh-so-civilized world. Germanische Heilkunde now shows us a way out of this misery. We can learn to understand what makes us sick, and we can eliminate these causes. In the future, we will avoid a lot of today's conflicts and thus stay healthier by forming families in an intact village society again, and having our own festivities again. And we could begin to implement now, today, precisely this redemption from this civilization junk society. The deep state recognized this danger immediately, when Dr. Hummer submitted his dissertation at the University of Tübingen, in 1981. For this reason, Germanische Heilkunde was denied its birth now 40 years ago. To this day, the mainstream makes immense efforts to scare the mass of people away from Germanische Heilkunde. Recently the Bild-Zeitung, a German tabloid, ran a cartoon showing 2 pigs and a farmer. One little pig says to the other, "I'm telling you, this farmer is fattening us only so that he can slaughter us, roast us and eat us." Says the other little pig, "You're a crazy conspiracy theorist." We could caption this cartoon another way too. The first little pig says to the farmer, "You, farmer. We here in the factory farm are so endlessly sick, and we need antibiotics, non-stop. In contrast, our ancestors, the wild pigs, out there, have no antibiotics at all. And are much healthier than we are here. We would like to have their medicine too." And the farmer would reply, "Dear little pig, I can't give you that medicine, because for that, I would have to release you into the wild, and I would be doing away with myself." The deep state would never have given us the Germanische Heilkunde voluntarily. It immediately recognized the socio-political explosion Dr. Hummer's discoveries would clearly trigger. And it immediately counteracted. The University of Tübingen voted 150-0 against Dr. Hummer. This ratio alone reveals their fraud. Could the vote actually mean That every one of the professors was such a medical highflyer that they recognized immediately that Hummer's discoveries were absolute nonsense. No. They could not have been such medical highflyers at all. Because if they were, they would at least have known the cause of cancer and other illnesses. Or the vote was rigged. Back to our initial question. Yes, we can protect ourselves from biological conflicts by making the state's goal people's health. Animals do this instinctively for sure, and I think plants do too. Our goal must be a natural biological, social order. Start with the smallest social cell, the mother-child social bond, which must be protected and cared for. That would be the man's task, so he forms the next larger cell of this natural biological social order, the family. Several families make up the clan and the village. Now it needs an elected leader, or decision maker. This village comprises a manageable group of perhaps 100 people. People help each other. Behind the next hill and in the next valley lives another clan, in the form of a village. One has relatives there, and one shares the same culture and holidays with this village. Behind the high mountains or on the other bank of the wide river lives a slightly different culture, with whom there are also frequent disputes. The culturally connected villages organize themselves against the other culture. One builds a military force with men, recruited from all villages, to be able to offer protection to the many families in one's own culture. The one task of the state is to give security to the people. The other task of the state would be to provide welfare. If a family or its farm gets into existential distress, the community must be able to catch it. With this security, existential conflicts and fears for the future are avoided. I recommend the film The Green Planet and also the book The Continuum Concept. In Search of Happiness Lost by Jean Liedloff. Such a biologically healthy society as depicted in these resources would also be wise, since there would be fewer territorial constellations, and thus fewer developmentally stunted people. I would like to visit such a biologically healthy human family and take you, dear philanthropist, with me. Do not psychologize. Learn to think biologically. This was often the admonishment of Dr. Hummer. But for the beginner in Germanische Heilkunde, to learn to think biologically is perhaps the most challenging thing. Purchase of new car. Your car has 500,000 kilometers on the clock, and you urgently need a new one for professional reasons. But how are you supposed to finance it? This is not a biological conflict, but a psychological problem. You already knew last year that you would have to buy a new car this year. So, you were not caught on the wrong foot. But if you go to your old car, and are startled to find that it has been rammed in a hit and run and is now unusable, that may very well lead to DHS. Can a toddler suffer conflicts? In reply to Dr. Hummer's teachings, a pediatrician once commented that a toddler cannot yet suffer any conflicts at all. This pediatrician thus showed that he had clearly chosen the wrong profession. Let's assume that a soldier of the occupying forces snatches a young mother's child from her arms, and then rapes the mother. In your mind's eye, take a look at the mother's face and the child's face. Both are in shock. Of course, the toddler can suffer conflict. Everything that is alive can suffer conflict. Suffering a biological conflict has nothing to do with the intellect. Can an unborn suffer conflict? During our 9 months in our mother's womb, from our conception to our birth, we live through the development of mankind in fast motion. Today, it's thought that life began to develop on the Earth 3.5 billion years ago. However, mankind itself has only existed since 6 million years ago. For the sake of calculation, we can equate each month of pregnancy with 1 million years of human development. Now, let's think about a 6 months pregnant woman, standing before the circular saw cutting firewood. The expectant mother can classify the screeching of the saw, and therefore she has no conflict. But where would we adult humans have run 3 million years ago, if we had heard this terrible screeching? For the 6-month-old unborn child in the mother's womb, this screaming sounds like the roar of a saber-toothed tiger, and it must expect to be eaten shortly. For the unborn, it causes a conflict. The same happens during an ultrasound examination. For the unborn, the noise of the ultrasound is roughly comparable to the noise of a helicopter taking off in the immediate vicinity. The unborn child can react with all kinds of conflicts, such as hearing conflicts that lead to deafness or motor conflicts, which lead to paralysis and, at birth, to a breech presentation. Furthermore, the unborn can also correspond one-to-one with a conflict of the mother. If the pregnant woman is startled to discover that her 3-year-old son has got his leg stuck in a machine, then the unborn child can sympathize with the mother's shock, and subsequently be born with a clubfoot. To better understand the archaic content of conflict, it is helpful to try to think like an animal. A fight for a morsel, which is the cause of pancreatic cancer, is easier to comprehend if one imagines dogs in a scuffle. In the case of a territory marking conflict concerning the urinary tract, it is also quite possible to imagine the dog lifting its leg. The territorial fight of rutting deer is an equally apt image, as is the play-dead central reflex with motor paralysis in the prey animal. These are biological conflicts, which apply equally to humans and animals. Animals do not psychologize either. Of course, our ancestors also made their observations and drew their conclusions from them. How else did the many sayings come into our language usage, which often hit the nail on the head? I cut my teeth on that. It hit me in the gut. I couldn't believe my ears. It was the straw that broke the camel's back. I couldn't swallow that. Often you just have to listen carefully to the patient, and with his words, you then go to Dr. Hummer's diagnosis chart. In general, only what the patient says counts. The patient only opens up to the therapist when he sees that the therapist is sincere, and that the therapist has mastered his craft. If the patient does not confide in the therapist is lost. Second criterion, the iron rule of cancer. The content of the biological conflict at the moment of the DHS determines both the localization of the SBS in the brain, as the Hummer focus, and the localization at the organ. That a Hummer focus also arises at the corresponding organ is perhaps less known. X-ray images showing a Hummer focus on an internal organ are mostly accidental. But these Hummer foci are even sometimes visible on the outer skin, for example, in psoriasis. Similarly, their shape is often clearly recognizable on the leaves of plants. Plants lack a head brain, they have only the organ brain. There is no one-way psyche brain. Conflict can also enter the brain through the organ level. If a morsel is stuck in the intestine and nothing can get through, then an intestinal cancer SBS will start up a bit mouthward of the morsel, producing more digestive juices by cell division, to be able to digest this stuck morsel. One must imagine these 3 levels of psyche, brain, and organ as an inseparable unit. The content of the conflict is always individual. The wife catches her husband in flagrante delicto. All 3 aspects of a biological conflict are fulfilled. It is highly acute dramatic for her, she has an isolated feeling, and she is caught on the wrong foot. Her vegetative state immediately switches into sustained stress mode, as happens for all special programs. But what exactly does she associate in this moment of fright? The localization of the Hummer focus in the brain depends on it. And this brain relay now, in turn, determines the SBS on her organ level. Sexual frustration conflict. Let's assume that this wife is devoted to her husband. She loves her husband and wants to start a family with him. Then she will feel it as a sexual frustration conflict of not being mated. Why is he sleeping with her and not with me? If she is right-handed, the Hummer focus will hit the left territorial area in the coronary vein relay, and develop ulcers in the coronary veins and uterine cervix, from now until the conflict is resolved. She will lose her periods and become conflictively male. On the other hand, if she is left-handed, she will develop her Hummer focus in the right territorial area and in the coronary artery relay, with ulcers in the coronary arteries and depression. The left-handed woman will continue to have her periods, despite this sexual conflict. And her depression will even make her hyperfeminine. Should the right-handed woman resolve her sexual conflict, after loading the conflict for over 9 months, she will die of a pulmonary embolism. On the other hand, the left-handed woman will suffer a heart attack in the crisis of the healing phase. And no matter how much the conflict load, she will survive this heart attack as a feminine woman. A female does not die of a heart attack. I explain this in more detail in the chapter, Sequence of Conflicts in the Territorial Area, Consecutio. Partner conflict. But suppose this wife has already considered herself, that her husband is not that Prince Charming whom she hoped to get in youth, and perhaps she has already thought about divorce. In that case, she will react with a dispute conflict, because of a violation of the husband's solidarity towards her and her family. As a right-handed person, she'll have the Hummer focus in the left mammary gland relay, in her cerebellum, and will react at the right breast junction from the brain to the organ level, with a mammary carcinoma. The reverse is valid for the left-handed person. That is, in the cerebellum on the right with a mammary cancer at her left partner breast. Sexual devaluation collapse. Suppose the 50-year-old wife catches her husband in bed with a 20-year-old. In that case, she will associate that she can no longer offer such a thing to her husband, with a sexual self-esteem collapse with a Hummer focus in the cerebral medulla ventricle and osteolysis of her pubic bone on the partner site. Fear, disgust, conflict. On the other hand, if she catches her husband with a prostitute in her own marital bed, it could disgust her. Depending on her handedness, she reacts with hypoglycemia or hyperglycemia. Loss of territory. But if this woman had her ovaries removed years ago, and therefore has male sensation, she may experience this as male loss of territory. She'll have her Hummer focus in the right territory area in the coronary artery relay, and as a result, she will suffer from angina pectoris. If she solves this conflict after more than 9 months of conflict loading, then she may very well die of a heart attack, as a male woman. Yet another wife has a young lover herself, catches her husband in flagrante delicto, and cynically remarks that this divorce will cost him dearly. This wife has no conflict at all. Because for her, it is not highly acute dramatic but perhaps even redemptive. Notice how one and the same event can, but does not have to, lead to a conflict, and can be felt very differently by different people or by the same person at different times. Therefore, the same event can once lead to no symptoms at all, and then again to the most different special programs. We must not psychologize, but learn to think biologically, because in the moment of shock, we associate. And this bypasses the mind. Do you catch your partner with your girlfriend or with a prostitute? Are you young or old? Do you have children or none? Are you rich or poor? Are you a Christian or a Muslim? One must always grasp the patient in his entirety. Is this event conflictive? The man's wife ran away. Occasionally, I am confronted with the following question: an acquaintance's wife has run away, and what will this acquaintance now react with? This question cannot be answered. Because one can almost never find a conflict with a third person. To find out, one must speak with this third person itself. Only this person can reveal his own conflict, no one else. Conceivably, there could be a loss of territory. A man counts his wife as his territory. If his wife runs away from him, he'd obviously have a loss of territory conflict. In a right-handed man, the Hummer focus would strike the coronary artery relay in the right territorial area. If he solves this conflict, he gets a classic coronary heart attack. In a left-handed man, the Hummer focus strikes the coronary vein relay in the left territorial area. If he resolves this conflict, he suffers a pulmonary embolism. However, the man whose wife runs away can also react with self-devaluation. Without his wife, perhaps he's not able to get through his life, leading to a Hummer focus in the cerebral medulla, and osteolysis in the femoral neck on his leg on his partner's side. But he might just as well react with a motor conflict, unable to hold his partner, with a Hummer focus in the motor cortex center, and paralysis of his partner's side leg. We also hug the partner with the legs. Then again, what if this man has a young girlfriend of his own, when his unloved wife runs away from him? In this instance, he might think to himself, finally, I am rid of her. In this case, he has no conflict at all. So, the same event, the man's wife running away, can lead to a conflict, but it doesn't have to. And whether it leads to this or any conflict, depends on his association in the moment of shock. And how he feels about his wife's running away. You were not present at this event. And even if you were, you could not easily look into the head of this husband. To say what a third party felt at this or that event, is not possible. Not predictable. Nor can we say in advance, that we will react this way or that way to this or that event. We can only say in retrospect that the person concerned felt that way. If one receives a request from the tax office to pay a horrendous tax arrears, it can certainly lead to an existential conflict, concerning the kidney collecting tubules with an Hummer focus in the brainstem. For example. But, what if you learn shortly before, that you have become a lottery millionaire? You just laugh about this relatively small additional tax payment, and you save yourself an existential conflict. So the same person, the same event. In one scenario it's a conflict and in the other not. So you can't predict a conflict either. Life usually comes differently than one thinks. By the way, a thick wallet saves you from many conflicts. There are no objective conflicts. There is also no event that would always lead to conflict for everyone, because there is no objective conflict, only subjective conflicts. What leads to conflict for me does not necessarily lead to conflict for you, and vice versa. Let's take the following scenario for example. The police storm my event while I am standing on the stage, giving a lecture on Germanische Heilkunde to a large audience. Suddenly the door bursts open, and the police storm the hall. What is going on in the minds of the audience? They probably think that the police are surely after this Pilhar and so have no conflict themselves. But what if I myself have no conflict either, because I learned in advance that the police would storm the house at this event? Nothing catches me on the wrong foot. I was expecting the police. But then, there's one listener in the back row on the right who has a massive shock, because yesterday he hit a grandma at the crosswalk with his car, and committed a hit and run. The hit and run driver has a violent conflict, because he is convinced that the police are coming for him and will arrest him right away. It turns out that in reality, the police aren't here for any one of us, but rather for the drug gang one floor below. They'd merely made a mistake about the door. So conflicts are absolutely subjective. In the same way, conflict solutions are always individual. What would be a conflict solution for you doesn't have to be one for me. Everyone has his or her own reality. The therapist must be able to engage with this. SPS helps us out of an emergency situation. When you fall in love with someone, you have the famous butterflies in your stomach, you're sympathicatonic, and you lose weight. Or suppose someone is shocked to discover she's the sole heir of a giant fortune. This would be nevertheless highly acute dramatic. One is now millionaire, an isolating feeling, one is the sole heir, nobody else gets anything, and one would be caught on the wrong foot. So is this a biological conflict? Does a special program start now? No. These special programs are there to lead us out of an emergency situation, the conflict. If one loses oneself head over heels, or if one suddenly inherits a fortune, this is not an emergency situation, but rather the opposite. The mouse before the cat. Now, one and the same event viewed by different individuals. The mouse before the cat. If the cat suddenly appears in front of the mouse, this is for this mouse certainly highly acute dramatic, an isolating feeling, and catching it on the wrong foot. Because now it is about the life of this mouse. So with the mouse, it comes to a DHS. The mouse may respond to this with a fear of death, affecting the pulmonary alveoli and an Hummer focus in the brainstem. Developmentally, this SBS pulmonary nodule is about improving the uptake of the air morsel, by cell proliferation of the pulmonary alveoli. In an animal experiment, a cage full of mice was placed on top of a cage full of cats. The cats reached up through the bars to the mice, and the mice jumped around like crazy. As a result, the mice developed pulmonary nodules. So we should put a label on every cat with the warning. Cats can cause lung cancer. After all, it can be reproduced in animal experiments. But it could also be that the mouse reacts to the cat with a motor conflict, a Hummer's focus in the motor cortex and sudden paralysis of its legs. Which is the play dead reflex or rigor mortis. This is because, when the prey stops moving, the predator desists from stalking the supposed carcass. In this way, the mouse can survive the situation. So the death reflex is the biological sense in the active phase, up to the moment of conflict resolution. In the healing phase, the function would come back, and in the crisis there'd be the epileptic seizure. My sister told me about how one day her cat carried a mouse in its mouth and placed it at my sister's feet in the garden. There it lay now, the supposedly dead mouse. She didn't want to immediately dispose of the cat's gift, but when we later looked for the mouse, it had disappeared. Apparently, the paralysis of the mouse was released when the cat was out of reach. The third mouse in front of the cat is decrepit, blind, and deaf and does not realize there's a cat at all and has no conflict at all. Now, let's look at this event from the cat's point of view. If the cat catches the mouse, everything is good for the cat. The cat got its food morsel. If it doesn't catch this mouse, It may react with a morsel conflict, concerning the digestive system with Hummer focus in the brainstem. But this does not have to be. As a hunter with a certain experience, the cat also knows that it will certainly work the next time. It could also be that the cat is actually still full, and it actually ran into the mouse by chance. So it would not be highly acute dramatic for the cat with this attitude, if it doesn't catch this mouse. From the human point of view, on the other hand, this event is entirely irrelevant. If the cat catches the mouse or does not catch it, that is the same for the human being, as long as this mouse is not the $500 expensive Australian jumping mouse that one got yesterday. This scene is indifferent to us humans. And one has thereby no conflict. That's just life, you might think to yourself. So, the same event is highly conflictual for the mouse. Possibly conflictual for the cat, and entirely irrelevant for the human. You should also never make fun of someone else about his conflict. It certainly wasn't funny for the person involved. Everyone has their own reality. The patient, who's the wife, says, "That was the worst event." The husband replies, "Don't start that again. It happened quite differently than how you remember it." Only what the affected person himself explains counts. It does not even have to be true. It is enough if the patient is convinced of his view of things. Here are two excellent case studies. A little girl's stuffed bear. A separation conflict can only ever be suffered by something living, a person or an animal. This is about cuddling. We do not cuddle with an object. The separation conflict goes to the outer skin, squamous epithelium, with the Hummer focus in the sensory cortex center. This produces symptoms of neurodermatitis, hives, psoriasis, warts, cold sores, and so on. A father's 4-year-old girl has had neurodermatitis, mainly on her face, for about 2 years. He deals with Germanische Heilkunde and finds out relatively quickly that his child must have suffered a separation conflict. But which separation conflict? The father could not think of anything. One day, the family went for a walk in the city. When a bus from a certain bus company drove by, the child called out, "My teddy. My teddy. My teddy." Then the father knew the separation conflict of his daughter. They'd rented this particular bus about 2 years ago for a company outing, and the child forgot her beloved teddy on this bus. The father had tried to get the teddy back at that time, but unfortunately, the teddy had disappeared without a trace. The child had wailed for days about the loss of the teddy. When the girl seemed to have gotten over it, the child developed neurodermatitis on her face. That is in the place where she predominantly cuddled her teddy. Now the father knows. Aha! It was this teddy. He calls the department store where they bought this teddy. But unfortunately, they no longer carry this product. Then the father places an ad in the newspaper, looking for a teddy bear, made by such and such company 2 years ago. He gets 3 messed up teddies sent to him. One's been licked, an ear is off. One's missing an eye. The third also has a few blemishes. Then the father has another idea. He writes his child a travelogue about how the teddy has come back home from a long, long journey. He is a bit worn out from the hardships, but at least he is back now. The father gives his child her teddy, and the child's neurodermatitis disappears. Thus ends the story. But this teddy is plush and not alive. Yet, in the eyes of the child, this thing is alive. And only that counts. It does not have to be true. It is enough if the patient is convinced of it. Everyone has his own reality. The blunt. The following case could also be called an instructive track case. In the moment of conflict, our brain snaps like a camera, and all possible sensory impressions are stored in the brain, as so-called tracks. From now on, one is then chronically ill with these respective tracks. One reacts allergically to these tracks, with complete recurrence of the original SBS. If one can avoid these tracks, one is healthy, and everything is good. If you cannot avoid them, you are chronically ill. Tracks can last a lifetime. The tracks themselves dissolve only through complete conflict resolution. Then the chronic suffering also disappears. A woman is diagnosed with intraductal mammary carcinoma. In her case, it was a resolved partner separation conflict. The milk ducts are lined on the inside with squamous epithelium. The associated conflict content would be that it tore my partner from my bosom, or tore my child from my bosom. In the active phase, This squamous epithelium ulcerates, and the cross-section of the milk duct becomes larger, allowing more milk to flow out, which is also the biological sense here. In nature, the mother would breastfeed through. But when the child is gone, the milk produced needs some other way to flow out. In the healing phase, these ulcers are filled up again under swelling, which is diagnosed as mastitis. With a little more conflict load, conventional medicine calls this symptom intraductal mammary cancer. So this supposed cancer patient had a quite violent partner separation conflict in healing. You know all this by knowing her handedness. About one day after her cancer diagnosis, she confided in her sister-in-law. And the sister-in-law advised the patient to consult Hummer. The poor patient did so immediately. She understood that her symptom was a healing phase symptom. To the doctors, she refused any conventional medical measures from the start. Her breast got better and better, and after 3 months, she went for a checkup. The doctors retracted their diagnosis and said, "In your case, it's just spontaneous healing. Here is the door." These doctors literally threw out the spontaneously recovered and now declared healthy. So beware, dear student, if you go to the doctor and say, "Doctor, I got well completely without your chemo." He'll usually be angry with you. So be prepared. The events underlying her healing phase were as follows. The patient works together with her husband in a bank branch. One day they got a new employee, a beautiful and exceptionally intelligent blonde. The patient had had a bad experience with a blonde before, when a blonde had snatched a partner from her. Now, of course, the patient was allergic to blondes around her husband. One day, the entire staff had to go on a training course, and the patient was the only one left in the branch. Her partner had gone on this course with this newly hired blonde. He came home from the training and said, "It was fantastic." Bang! The patient had a full recurrence. Her husband fell on his knees in front of her and begged her to believe that there was nothing going on with this blonde. But the patient was fully conflict active. A few weeks later, the blonde comes and says, she is going to get married and move away. So she was quitting now. A stone fell from the patient's soul. The blonde disappeared into thin air. That was her conflict resolution. A few weeks of conflict load were followed by a few weeks of healing phase symptoms, and the spook was over. We are still on the subject of this case study. Everyone has their own reality. Let's say you were a therapist, and you found this conflict while it was active. And let's say you summoned the blonde and her husband, who both credibly assure you that nothing was going on between them. As a therapist, what is there to solve now that nothing has happened? What is there to change? The patient only believes that something is going on between the two of them. We must learn to think biologically. The patient showed you how it works. The patient got well spontaneously. And how? The blonde must go. Recently, a seminar participant advised us to change the hair color of the blonde to black. That would also work. The patient is allergic to blondes, and not to black-haired women. So the therapy recommendation is to avoid tracks. Some newcomers will protest at this point. Avoiding tracks is not a solution. Attention, learn to think biologically. The goose has a right to avoid the fox. Even if the fox says, "Goose, I find that discriminatory of you. Some people mean no good. I cannot change this person, but I can avoid him." Avoiding a track is a biological solution. Especially as a therapist, you have to understand the biological language of Mother Nature and know how to distinguish between it and psychologized solutions. You are responsible, and the patient trusts you. The associated conflict content. The conflict content, associated at the moment of DHS, is what we call the vocabulary of the biological language of Mother Nature. This language applies equally to humans and animals. This is what we must learn to understand. What is meant by a morsel conflict? One evening, my Rottweiler dog Emma and I were served a delicious steak in a restaurant. So precisely was my feast served that the pink meat was still sizzling. My next glance was at Emma, who tried to hypnotize me with her expectant eyes. Such a telepathic mind game between us succeeded quite often. I knew what she wanted, and Emma knew what I wanted. Words were not necessary. Let's go back to the morsel conflict. In those minutes, Emma and I both saw that steak as a morsel to be devoured. Since I was really hungry, and the meat was way too hot for Emma, I let her look and gave her nothing. Besides, I had the further excuse that I was in a restaurant with the dog. Some would say it's good training for a dog to be given nothing at the table. As a thank you, Emma reacted that night with diarrhea. And twice I had to go out with her from the warm camper into the cold winter night. Emma had unintentionally taught me a lesson. That steak was a morsel in my eyes, and even more so in Emma's. I got that morsel and had no conflict. But for Emma, it became a morsel conflict. She had actually already digested this steak morsel, because she usually gets a morsel from me at the table. That I would actually give her nothing, she did not expect. To humans, a bundle of banknotes lying on the table can represent quite a morsel, something we would like to take into ourselves somehow. What beautiful things one can buy with this money. If this intention fails, then humans can react entirely with a morsel conflict. For a dog, however, this bundle of money isn't worth a damn. What is meant by a worry dispute conflict? Especially in the case of mammary gland cancer, the beginner understands relatively quickly the biological sense of this particular program, which is in the conflict active phase, a worry about the child or partner, creating a cell proliferation of the mammary glands to form more breast milk. Somewhat more difficult to understand is why the woman with a partner conflict also produces more breast milk. Biologically, both should be the same thing, or at least something very similar. What is meant by a defilement conflict? To understand the conflict content, we must understand evolutionary history. Mother Nature developed the dermis to protect the individual when he left the sea and conquered the land. The associated brain is the cerebellum. When one is spat upon, one feels defiled. If one is surgically mutilated, then one can feel disfigured. If one is spoken ill of, then it can be associated like an arrow in the back. So, if one's integrity is violated, then the dermis reacts with cell proliferation to make the wall thicker on the outside. What is meant by a self-value collapse? A self-devaluation collapse goes on the connective tissue. The strongest self-devaluation collapse goes to the bone. In the conflict active phase, the bone osteolizes to its complete dissolution. When a child realizes in the moment of shock that his mother doesn't love him, the child's bone skeleton more or less dissolves. The dog can feel the same when her master beats her. What is meant by a sexual frustration conflict? In sexuality, the woman is frustrated when, for example, her husband cheats. Why is he sleeping with her and not with me? The bitch in heat reacts with precisely the same conflict when she is dragged away from the male dog. But also, a girl can react with such a sexual conflict when she, herself still immature and before her menarche, is confronted with the topic of sex for the first time. Both adult women and immature girls have their Hummer focus in the same place in the territorial area. Of course, this is accompanied by a change of character in both of them. Receptivity due to change of the hormonal status. I do not want to complicate it at this point, but you should read or hear this at least once. If one has suffered a territory area conflict and one's hormonal status changes later, perhaps due to menopause, another conflict, or pregnancy, then this conflict can suddenly become irrelevant and dissolve. But it can also jump to the opposite side of the brain, in the territorial area. If this conflict can also be experienced with the new hormonal status, this can possibly become dangerous. In the crises that follow, should the original and now resolved conflict have built up a significant conflict load. Conflicts can in this way be re-experienced. No one-way street. There is no one-way street for the conflict from the psyche to the brain. There is also the possibility of suffering a conflict via the organ level. If the bone breaks, then this event is fatal in nature. When you have a bone fracture, you have your Hummer focus in the cerebral medulla, utterly independent of whether you are aware of that bone fracture or not. When Olivia first got home from the concentration camp, cancer center, we immediately ran with her to a radiologist to get a cranial CT. A Hummer focus could be seen for the ribs in the cerebral medulla, and Dr. Hummer could not make sense of it. Only afterward did we learn that Olivia had had to be resuscitated due to the anaphylactic shock of the first chemotoxic gas injection, and that the doctors had caused a rib series fracture on her left and right side. So, in Olivia's cranial CT, her fractured and healed ribs were visible. Another example of this would be the almost obligatory metastases to the liver and colorectal cancer. The active morsel conflict, affecting the intestine, is not only the cause of cell proliferation of the intestinal villi. There is also a paralysis of the smooth intestinal muscles in the affected section of the intestine, which is called paralytic ileus or constipation. Due to this intestinal paralysis, less and less food can get through, and the individual is in danger of starvation. As a result, the liver switches on with an increase in the number of parenchymal cells, in order to produce more enzymes to make the best possible use of even the smallest piece of food. If the patient is now diagnosed with colorectal cancer, there is usually also something happening in the liver. This has nothing to do with migrating cancer cells. These creeping, crawling cells have also never been found in arterial blood, even though they should be found there, in order to be able to reach everywhere in the body. These are all propaganda fairy tales of conventional medicine, and have nothing in common with facts. This colon cancer patient has suffered a further conflict for the liver, via his organ level. And this already at a time when he did not yet know about his colon cancer, but his organism has already conflictually realized the emergency situation. Another example of this. There is some egg mayonnaise on the table in front of me, that is contaminated with salmonella. Maya signals, "That looks delicious." I put a spoonful in my mouth, and my taste buds confirm, "Yummy." I swallow. But we humans are not scavengers. For us, this mouthful of salmonella is an indigestible morsel. Now my intestines say, "For heaven's sake, what's that coming from?" And signals to the brain, "Diarrhea." Everything has to come out. It works similarly with cholera. If one drinks river water, where upstream corpses float in the water, then one has so much vomiting and diarrhea, until one gets clean water to drink again. Germanische Heilkunde does not apply to injury and also not to poisoning. However, with both events, one can very well react with a conflict. Inheritance. There is heredity, no doubt about it. We look like our parents, and our children look like their parents. It is also impossible for a white couple to give birth to a black child. One, like the other, is hereditary. But there is no hereditary cancer or the like. If the mother and her daughter have or had breast cancer, then there must be a corresponding DHS in both of them. Now, there is no hereditary cancer. But nevertheless, a particular theme can dominate a family, over several generations. For example, the theme of sports. The grandfather was a famous sportsman. The father also has his many trophies standing around the house. And the little son emulates his great role models. The grandfather sometimes suffered sports self-devaluation conflicts with knee pain in the healing phase, as his son had also suffered from time to time in his sports career. And now the grandson has, since he started playing sports. One might be inclined to say, that the son inherited his weak knees from his father, who inherited it from his grandfather. But this is nonsense. All three athletes have suffered and been able to solve their own athleticism self-devaluation conflicts with Hummer focus in the cerebral medulla, and recurring overtracts. It was not heredity, but shared enthusiasm for the sport. And their respective conflicts associated with it. Carcinogenic. Can poisons trigger a sensible biological special program? We will discuss this topic in more detail in the therapy chapter. But the first answer is, no. Yes, there are undoubtedly highly toxic substances. But no substance could reproducible trigger any SBS, even in a perfect case. Such claims of a relationship between toxins and cancer are based on statistical correlations, which we do not need in Germanische Heilkunde, culturally conditioned. Just as sports can bind generations of a family, the culture in question can naturally cause specific conflicts for its members. In Japan, the incidence of the prostate program is lower, in the per thousand range, and breast cancer is also relatively rare. In our culture, on the other hand, the incidence for both special programs is in the double-digit percentage range. In Japan, cheating is considered something awful, and the Japanese do not get involved in such things. Which means that they also suffer these resulting conflicts much less frequently. On the other hand, we jump from bed to bed without commitment. And then we are surprised when marriages fall apart. The fact that we are getting sicker and sicker due to the decay of our own culture is not officially discussed for certain reasons. But now, with Germanische Heilkunde we see the truth, and will direct our steps differently in the future. Another revealing case study. Brother and sister-in-law were invited to visit a doctor couple in Cyprus. The doctor's 11-year-old son has had asthma since the age of 2. The doctor couple explained that their son's asthma was a hereditary disease that existed only in Cyprus and nowhere else in the world. The remarkable thing about this hereditary disease is that it is inherited only through male genes. Only the boys would have to deal with this asthma. The girls in Cyprus would be spared from it. Brother and sister-in-law knew the Germanische Heilkunde and knew that the cause of asthma is a scare fright or territorial fear conflict, and spoke to the boy about it. At the age of 2, he must have suffered such a scare fright or territorial fear conflict, because that's when his asthma started. The now 11-year-old countered that something like that might have happened when his father threw him into the sea, when he was 2. It turned out that in Cyprus, there is an ancient ritual. In order to make a man out of his little son, fathers throw their sons into the sea when they are 2 years old. They do this with their sons, but not their daughters. Therefore, this asthma does not affect the girls. Of course, this being thrown into the sea is highly acutely dramatic for the boys, creates an isolated feeling, and catches them on the wrong foot. That they associate with it either a scare fright or territorial fear is obvious. So, this alleged inheritance via male genes, and only in Cyprus and so on, is nonsense. Such a terrible ritual for the 2-year-old boys exists only in Cyprus. This is the only special thing. The cause of asthma is the same worldwide. Namely, a scare fright or territorial fear conflict. Occupational diseases. Cervical carcinomas are rarely found in nuns, but are very common in prostitutes. Nuns, we can assume, have less frequent sexual conflicts than prostitutes do, due to their profession. The nuns are all married to Jesus, and do not cheat on this bigamist. Meanwhile, in the horizontal trade, it is almost only about cheating and similar sexual issues. Age-related diseases. Age-related diseases, like all diseases, are purely conflict-related. For the 2-year-old John, mom is the most important person in his life, and he does not want to be separated from her at any time. If a separation conflict occurs, neurodermatitis may result. On the other hand, at the age of 16, John is happy to go to the disco without his mother. As is well known, neurodermatitis often disappears during puberty. John has now broken away from his mother and has gained a different perspective on things. 16-year-old John has other problems. He often finds himself, because of his acne is not pretty enough, in the mirror, in front of which he spends hours a day. He always feels disfigured anew through his own reflection, which now causes him to get into sagging healing, with his corium skin. Then, for 60-year-old John, this little vanity has long since ceased to have any significance, which is why acne is virtually non-existent in this age group. John at 60, however, has heart problems. Because things don't work out for him in his professional or private life. His problems are heart problems and burnout. At the age of 80, John's bones no longer play along. His osteoporosis is due to a drop in self-esteem, because no one seems to need him anymore. John's biggest problem is his feeling of inferiority. Over all these years, from childhood to old age, it was always John. But you can't compare the 2-year-old with the 16-year-old. Nor with the 60 or 80-year-old. In other words, what was conflictual for you yesterday, doesn't have to be today, and vice versa. As a child, the topic of money was trivial to you, and today it is highly conflictual. So, conflicts are not only absolutely individual. They also depend on the current age, the current hormonal situation, and so on. It is also not the case that if you have gone through a special program, you are now immunized against it, and cannot get it later in life. One is never really immune to conflicts. And there is no such thing as an immune system. One elderly woman reported that she had had mumps 3 Christmases in a row, as a child. She'd had to help out in her parents' pastry shop, but was not allowed to nibble on the many goodies. On Christmas Eve, the sweets finally arrived on the table and triggered the healing phase of the parotid gland excretory ducts in her, which is also known as mumps. Even with mumps, people thought you would only get it once and then you would be immunized for life. This is nonsense. For a child, sweets have a high significance. The pubescent just takes a cookie, even if behind the back of the parents. The adult buys cookies when he feels like it. The cause of mumps is not being allowed to salivate a morsel and involves the squamous epithelium of the excretory ducts of the parotid gland. Of course, the adult can also suffer such a conflict. However, it is more common in children. Nothing negative. A special program now starting with the biological conflict is nothing negative in and of itself. It helps sensibly to solve the cause. Most special programs have their biological sense immediately in the conflict active phase. Mother Nature helps immediately. The special programs of cerebral medulla group have their biological sense only at the end of the healing phase. Still, this biological sense remains as a permanent functional reinforcement for life. Mother Nature never does anything evil. A conflict cannot be prevented. The conflict simply happens. For this eventuality, Mother Nature has programmed into us these many different special programs that are started at the push of a button, the DHS, when needed. It is not the symptom that we should fight. Instead, we should focus our attention on the cause. Actually, these special programs are not only nothing negative, but they are even necessary to make a biologically sensible living together at all possible. Keywords: alpha and second wolf. In nature, one alpha is enough to take care of reproduction for the pack. Think of the rooster, which can easily handle 20 hens. But for a pack to function, it needs many second wolves. And these second wolves are constructed by Mother Nature through conflicts. The alpha has no conflicts in the territory. This is what distinguishes the alpha. The rest of the males in the pack are second wolves, who are not responsible for reproduction, and do not want to be. They have been cerebrally castrated by the alpha in a territorial struggle, and are thus gaily fixated on the alpha. Through these conflicts, Mother Nature constructs the natural hierarchy, which is even recognized between species. We humans immediately recognize the alpha in the wolf pack by his demeanor and, of course, the second wolves by their demeanor. But even in a pack of people, the dog recognizes which of them is the boss. Such a natural hierarchy needs no further explanation. There can be no cheating here. Even the company has a boss and its quantity of coworkers. No clan and no company is led democratically by the majority of the second wolves, because it couldn't function. Yet somehow we've been persuaded that we could lead a whole country on democratic guidelines. This shows how far we humans are already removed from our nature, and how deeply entrenched we are in this artificial matrix. Others control us in the truest sense of the word. The matrix sits in our heads. We have to rethink. The Germanische Heilkunde can show the way out of this matrix, and this without faith, but with natural laws. Of course, there would also be conflicts in a biological society. But nothing even close to the extent that exists in our present civilization junk society. Pre-life. Dr. Hummer's Germanische Heilkunde covers the time span of the individual, from the fertilized egg until his death. Dr. Hummer does not say what was before or what will be after. Whether there was a previous life or there will be a life after death, Dr. Hummer does not say. Nevertheless, I can prove to you in a minute that we have always lived through our ancestors and will always live through our children and grandchildren. If only one of our grandmothers had not been, we would not exist. Raising a child is tedious, which is why you honor your ancestors. Since you want to live forever, you strive to have children and grandchildren. So one lives on in one's children and grandchildren. One can prove all this genetically. The second kind of immortality is that of Bach, Mozart, Hummer, and so on. These people live on in the memory of future generations, through their merits. Such immortality is also real, and need not be believed. There can also be something like an ancestor memory, experiences of one's ancestors that one can access in present life. For example, as Dr. Hummer explained, this mother has breast cancer on her mother-child side, because her child fell from a tree. Dr. Hummer does not explain why the child fell from the tree. Was it carelessness, the rotten branch the child pushed? Did he jump out of stupidity, or perhaps even out of suicidal thoughts? A connection with a past life would condition these events to be rejected out of hand from the view of reproducible science. To claim that one is now ill, because one's great-grandfather was a marked man, is a hypothesis that cannot be proven. Such a hypothesis would also be incompatible with the biological sense. Mother Nature is the only objective truth. So now, if there is a symptom, one must always look for the associated biological conflict in this life. It can have happened prenatally, of course. Biological conflicts are not hereditary. With the help of a cranial CT, one can prove this. The chief of the procedure. Who can know the conflict? As already mentioned, it is impossible to find a conflict in a third person. A wife sits in a coffee house and sees through the window her husband walking hand in hand on the street with her hated competitor. For the wife, this is shocking. The three aspects are fulfilled. She does not speak to anyone in the coffee house about this scene. Who could now find this woman's conflict? That is impossible. Only the woman herself can reveal it. The therapist's art is now to ask this woman the right questions, so that she can find her own way to her conflict. And then, when she has found her conflict, she will tell it fully. Who can solve the conflict? A conflict is resolved when you get over it. When it can no longer happen at all, or when you can laugh about it. If you can't do that, then you have to avoid the tracks, to prevent recurrences. If you don't manage that either, then you are chronically ill. Let's assume that this woman in the coffee shop suffered a conflict with breast cancer in the process. Let's further assume that her husband is Casanova. Which is why she cannot resolve her conflict. Wise advice to her would be to separate from this Casanova. The Casanova himself is in a schizophrenic constellation, and cannot easily escape his own shadow. If she stayed with him, it would possibly end badly with her breast cancer. The enemy of the good is the better. So, the woman must find a better husband. Then she would be able to overcome her conflict, and her breast cancer would go into resolution. The therapist can give her this advice, but he cannot live her life. It is up to the patient to find a better husband. It is not the therapist who solves the conflict, but always the patient herself. One phenomenon should be mentioned here. Some conflicts just hang in the air. They do this, of course, via tracks. Here it is enough as a therapist to let the patient recognize his conflict back then, which dissolves into thin air. He does this when this conflict can no longer happen today, for example, because the patient is no longer the little child of that time. The patient thus brings up his previously repressed conflict, which today has long been without object, from his subconscious into his present waking consciousness. Thereby he recognizes the difference between himself from back then and his inner attitude from today. He realizes that this conflict is now irrelevant, and, poof, the conflict and the tracks are gone. I will go into this in more detail in the chapter on tracks. So the therapist found the conflict together with the patient, and from then on, the patient became healthy. Did the therapist heal? No, it was again the patient himself. His present individual feeling was able to solve the conflict of that time. Who can heal? Of course, one can actively help a poor wretch resolve his conflict, by giving him money or a job. There are many interpersonal opportunities, where you can use your own humanity in a healing way. If you can help save another person's life or regain his health, it also distinguishes you as a human being. Nevertheless, it must click in the affected person's brain so that his body switches to healing. The patient himself also does the healing phase process. The therapist in Germanische Heilkunde can therefore heal just as little as other therapists. Only the sick person can heal himself. The Germanische Heilkunde therapist also sees himself as the patient's friend, and his knowledgeable helper. The important person is the patient himself. Only he knows the cause, and only he can make himself healthy again. The patient should be made aware of this in advance. Third criterion of the iron rule of cancer. The third criterion of the iron rule of cancer states that the course of a sensible biological program is synchronous at all three levels: psyche, brain, organ. The individual. But before that, a few words about the individual, about whose three levels this is all about. Another fact that has been removed from our minds is that we are an inseparable unit with our organ level and our psyche. One can also say soul to the psyche. But conventional medicine divided us into a body and a psyche. We have psychiatrists who have no idea about the organ level. And we have organ doctors who have no idea about the psyche, and often even negate it. We have been split. Divide and conquer, an ancient principle. The organ physicians even dare to divide the organ level into specialties. There is the neurologist, the nephrologist, the urologist, the dermatologist, the specialist for the left nostril, and the specialist for the right nostril. They can no longer see the forest for the trees. But they also don't want to see anything at all or be convinced by facts. And this has been the case over the past 40 years, and still is the case today. And the psychiatrist drives around in the psyches of his poor patients, like an elephant in a china shop. The high suicide rate among psychiatrists speaks volumes. But if the patient learns, with the help of Germanische Heilkunde, to understand how his body works, and why he has this symptom, he usually knows what to do. He is freed. Because as the saying goes, danger recognized is danger averted. The patient becomes the boss of his process, and lets neither doctor nor medicine stand between him and his health. The knowledge of these connections makes us free. As a rule, the conflict active symptoms follow on the heels of the DHS. One recognizes them the easier, the better one knows the Germanische Heilkunde himself. If one becomes aware of an active organ symptom on one's own body, for example ice cold hands, then the triggering conflict is usually still fresh in one's memory. The conflict content itself is known from the symptom, like increased blood pressure. So, you know what to look for in yourself at the level of the psyche. In the case of elevated blood pressure, the cause would be a fluid conflict. And you can determine the time of the conflict with the first appearance of the symptom. In one's interest, one will now try to resolve this conflict quickly. If this succeeds, the conflict load is kept small, and the subsequent healing phase will be less complicated, less difficult. Emergency medicine is also only necessary in the case of large conflict loads. If conflict loads can be kept small, then there is no need for emergency medicine. Therefore, the knowledge of Germanische Heilkunde must be included in the biology lessons at schools. Every mother must know how neurodermatitis works in her child. On her own, this mother would try to solve the cause of her child's neurodermatitis, and also be able to solve it. In this, a way, we would be able to free ourselves from this civilization junk society. Automatically, we would take a different path than before. We would see that the destruction of the family is making us sick. If we followed our natural biological code, instead of this artificial compulsion, we would become truly human. We would be freer, healthier, and certainly more spiritually inclined than all other creatures of this planet Earth. Then we would indeed be the crowning glory of creation. Actually, we humans would only need to be thoughtful gardeners on our Earth. What if that would be the actual meaning of our existence? Overdetermined diagnostic system. Through this synchronicity of the three levels, psyche, brain, organ, the Germanische Heilkunde automatically has an overdetermined diagnostic system. Overdetermined means, if you want to describe a straight line in space mathematically, you need for this 2 points of this straight line. However, conventional medicine uses only 1 point. Thereby, the imaginary straight line can go through somehow, and one can predict nothing and determine nothing backdated. This single point of conventional medicine is the organ level with the laboratory values, X-rays, etc. We in Germanische Heilkunde, on the other hand, have 3 points. Namely, the organ level like conventional medicine, but in addition the psyche of the patient. And his brain level with the active or dissolved Hummer focus. The same mistake as conventional medicine, which only muddles around on the organ level, and leaves out the level of the patient's psyche. This then is made by the so-called alternatives healers, which only muddle around on the level of the psyche, and leave out the organ level. Keywords, kinesiology, family constellations, and so on. But you can't screw around on one level without affecting the other 2 levels. There are conflicts, which one better does not solve. But all of them, the conventional and alternative medicine, lack the reproducible connection between the 2 levels, organ and psyche. The Germanische Heilkunde explains this connection. One can always and at any time conclude from one of the levels to the other 2 levels. Suppose the man has a bald head on the organ level. In that case, he has an active separation conflict on the psyche level. And the corresponding Hummer focus in the sensory cortex center, in the shape of a shooting target. Suppose there is an active Hummer focus in the cerebellum, on the right. In that case, the person has breast cancer on her left breast. And on the psyche, an active worry dispute conflict corresponding to his biological handedness with or around partner or mother-child. The most challenging thing is to conclude from the level of the psyche. But this is also possible. A case study from psyche to organ level, testicular cyst. Because of Dr. Hummer, I fell out with my friend and did not speak a word with him, for years. But one day, we sat at the kitchen table and rekindled our old friendship. He told me that he had done scream therapy in a soundproof room. Images from his childhood at the age of 5 came up to him. He was standing in a room of his parents' house, next to his dead father. He had been laid out. I was immediately electrified. My friend was describing a conflict from childhood. When an image like this, buried in the subconscious for years, comes up, it is often a clue that it is a biological conflict. At the moment of DHS, our brain snaps like a camera. The brain stores everything relevant to itself. The person, the smell, the light, the place, the sounds, and so on. These are then the tracks. Such an image programmed into the brain, but repressed into the subconscious, occurred to my friend from childhood, a terrible image. The dead father, and next to him the little boy who loved him. If the father dies, to the 5-year-old. A lost conflict with testicular necrosis and testicular cyst in the healing phase is apparent. I knew my friend well enough to say that he could not possibly have testicular necrosis. He loved women too much for that. The opposite, a testicular cyst, was more likely in my friend. I asked him if he had had testicular pain in childhood. And actually, he must also have a thickened testicle, I claimed without further ado. With wide eyes he confirmed my assumption. I knew that now, I could finally convince my friend of Germanische Heilkunde, and I said, "So, now I'll tell you which of your testicles is the bigger one. Being right-handed, which you are, it must be your right testicle, because the father is a partner. Right on target." He was astonished. My friend related a personal experience from his memory, the level of the psyche, and I realized it was conflictive. I have the diagnosis chart of Dr. Hummer in my head. From the level of the psyche I deduced the organ level and hit the bullseye. My friend went on to say that at that time, after the death of his father, he also had Pfeiffer's glandular fever, which of course indicates the healing phase of a mild central self-devaluation conflict. The death of his father hit my friend like a thunderclap in his childhood. From the actions of the affected person to his psyche, mythomania. Another example from my everyday life, where I got confirmed the organ level starting from the psyche. A sympathizer writes me a meter-long email. This extensive text alone already indicates a mythomaniac constellation of the author. Then he called me and talked my ear off. When he then explained that he had cracks in his anus, my suspicions were confirmed. The mythomaniac territorial constellation has a Hummer focus in the left territorial area, in the rectal mucosa, and a Hummer focus in the right territorial area, in the bronchial mucosa. The mythomaniac is manic and not depressed. The depressive in this constellation would be talking to himself. Thus, the left conflict must be more emphasized in the mythomaniac than the right one. In the conflict active phase, the squamous mucosa of the rectum ulcerates the more this conflict is emphasized. And these were the cracks in his anus. I am often asked how to spread Germanische Heilkunde most effectively. Here is the answer. Study it yourself and wait for the opportunity. The one who has understood Germanische Heilkunde on his body does not have to believe in its correctness anymore. He knows it. In his interest, he will now help to spread it. In a positive sense, he is now infected with Germanische Heilkunde, and thus infects other human creatures. But one can also say that we open the eyes of others for biological connections. Against a biological truth, there is only the lie as an antidote and accompanying suffering. This third criterion of the iron rule of cancer explains that in the second of the DHS, the Hummer focus arises in the brain and at the corresponding organ, and with it, an immediate cell change or functional failure sets in. However, in the first seconds, minutes, and perhaps hours, an organ change will not be detectable with the best diagnostic method of conventional medicine. In the brain, however, based on the Hummer focus, it could be diagnosed immediately. Generally, the conflict active phase on the organ level is not always immediately noticeable. We see with this also, that the synchronicity of the 3 levels is given from the beginning, and must be because it is about an individual. At this point, I would like to emphasize the powerful discovery of Dr. Hummer. His discovered biological laws of nature apply in living matter. For the dead matter like minerals and so on, other laws of nature are valid. but the living matter also follows natural laws. Dr. Hummer was able to discover 5 of them and give them to us as information. In my opinion, natural laws are an expression of the creation will. Powerful information for the patient. The most powerful information from this third criterion, I would like to describe, is in the form of an experience report of a therapist. This therapist was investigating spontaneous healing worldwide, and told me the following patient case. A manager was ill with cancer, and he wanted to confront his cancer with ayahuasca, an intoxicant extracted from a liane, to confront his cancer. The manager expected to meet a monster. But no. Under ayahuasca, he met his cancer, which was utterly kind to him. The manager didn't understand anything anymore. He continued to think, if it was not cancer that was evil to him, then who was it in his life? It was his boss and his wife. He quit his job, got divorced, and spontaneously recovered. I want to clarify with this testimonial. If the person affected understands the conflictual trigger of his illness, he can purposefully eliminate the cause and thus recover. He knows that when the stone falls from his psyche, the special program on the organ level stops, and the healing phase inevitably takes place. The patient can actively contribute to his recovery by putting his life in order. He thus rises from his subconscious, consciously changes one or the other thing in his life, and can thus have a healing effect on his subconscious. Making predictions. One can also look into the future with this knowledge, and predict, for example, the crisis to the day. Pregnancy and birth also proceed according to this scheme of the two-phase. The fertilization of the ovum is quasi the DHS, which is, however, none. The fertilization of the ovum does not represent a biological conflict. However, the first sympathicotonic phase of pregnancy starts now, which lasts for 3 months. It has its peculiarities. The vagatonic second phase of pregnancy begins from the 4th month of pregnancy, which lasts 6 months and has specific characteristics. The crisis is the sympathicotinous birth, followed by an again vagotinous breastfeeding period of up to 4 years. This lactation period also has its specific peculiarities. And just as one can predict the birth in pregnancy, one can, in the same way, predict the crisis of an SBS in time, provided one can estimate the load of conflict. One can not only look into the future, but also modify it. A successful real estate agent brokered his dream house and, shortly after that, his dream woman. The catch was, this dream woman did not want to get pregnant, and the broker separated from her again. The neighbor, however, always had an eye on this woman, and seized the opportunity by the hair. The dream woman moved out, and in with the neighbor. That was not yet the conflict. But one day, the broker saw his ex-wife pregnant. The neighbor had done what he was incapable of doing. The broker's loss of territory conflict and his severe angina pectoris led him to Dr. Hummer, years later. Since his conflict had been going on for several years, and a second child of his ex even exacerbated him, resolving this conflict would be fatal to the patient. He could not survive such a violent heart attack. So, Dr. Hummer advised him to walk past his ex's house every day, and to get appropriately angry. If the patient followed this advice, no heart attack would occur. The patient would remain active in the conflict, but he could become ancient with it. And just as one can comprehend this synchronicity from the beginning, one can also comprehend conflict resolution. The stone falls from the patient's soul, and he immediately becomes vagatonic. He immediately changes his hand temperature from cold to hot. The crisis. The crisis in the middle of the healing phase, whose task is to steer the rudder back towards health, is also synchronous. From the conflict resolution on, the exudative healing phase was present with edema formation in the brain, and on the organ level. With the crisis, this process stops abruptly, and this edema is squeezed out. In the peeing phase that now occurs, patients have to go to the toilet frequently. From this crisis on, the scarred restitutive healing phase begins. At the end of the healing phase, the brain relay and the organ plane remain scarred. And scars remain, but do not disturb further. This crisis was always initiated in the deepest vagatonia, thus mainly in the morning, around 4 a.m. This initiation is done by a dream, or by suddenly concentrated thinking about this already solved conflict. So, this crisis is initiated via the level of the psyche. The crises themselves are always brain symptoms. Also, the famous heart attack has nothing to do with closed coronary vessels, but with the heart center in the right male territorial area of the cerebral cortex. The closed coronary vessel is the corresponding healing phase symptom on the organ level. But it is not the cause. Thus, the epileptic seizure is also a brain symptom. Therefore, stupid conventional medicine removes this part of the brain from the person with epilepsy. In the graphic, the crisis is described as epileptic epileptoid. Epileptic are all crises of striated muscles. Epileptoid, which is similar to epilepsy, is all other crises, such as absence, migraine, etc. If one has some insight into the psychoses with the different constellations, one can conclude from the outer behavior of a person to his active special programs. If one has a choleric before oneself, one knows about his two active Hummer focus in the stomach and rectum relay of the two territorial area halves in the cortex. One also knows because of his mania, that the left conflict is more weighty than the right. Organically, he has few symptoms. The rectal squamous epithelial mucosa is sensory paralyzed and numb in the active phase, as it belongs to the external skin pattern. The small curvature of the stomach hurts in the active phase, pharyngeal mucosal schema, but is not conflictively emphasized due to mania and does not hurt much, if at all. The interrogation of the organ symptoms in a choleric is therefore not very productive. However, his psyche is striking and distinctive. His psyche can now be concluded to his brain level, with the constellation and his organ level. One must imagine this diagram of the two phases for each level separately, to calculate more simply. In reality, however, this separation of the three levels does not exist. The individual is a unity. There is also no organ symptom without a corresponding correlate in the psyche. None. If there is a symptom, then a corresponding conflict must have happened. So, if the partner comes back from taking out the garbage can and sneezes, he must have suffered and resolved a corresponding stink conflict. Even then, if he should have expressed, "I'm happy to do it, honey." If you can interpret the organ level, you no longer can be badly lied to. What happens at the DHS? Durkheim syndrome. Zooming into the biological conflict shock, can detect many simultaneous events. Let us now mentally look into the face of a human being, or a small child, when they are suffering a DHS. Logically, the changed facial expressions will turn out differently, and are not and cannot be the same for everyone. The horror is written on the face of one, the face of the other falls. With the first one understands that he became ill. But also, the other one has suffered a biological conflict, and can become chronically ill in the same way. In the end, it is always about the subjective feeling of the affected individual, not about the feeling of an outsider. At the moment of the DHS, the vegetative nervous system instantly switches from a normal, balanced day-night rhythm to permanent sympathicatonia. This DHS is the cause of the disease and must be found, because the therapy must be derived from it. To many, the search for this DHS seems like the search for a needle in a haystack. Finding this conflictive moment in the patient's life is often a detective masterpiece. So, it is not the constant stress that makes people ill, as psychosomatic erroneously believes, but this moment of conflict. What did this person associate, at this moment of fright? This conflict content determines the localization of the Hummer focus in the brain, and thereby the organ disease. Synchronously on the three levels. This brain relay, in which the Hummer focus is now present in the form of a shooting target, controls the respective tissue at the organ. Via the nerves, this connection between brain and organ is hardwired. One must learn to understand this associating archaically from the development history. Since we humans are related to mammals, we have shared a long stage of this evolutionary history with them. A morsel conflict, care conflict, self-devaluation conflict, separation, or territorial conflict thus starts the same SBS in humans and animals. For this reason, Germanische Heilkunde with its 5 biological laws of nature, applies equally to the animal. In the same way the infant and the unborn associate. Mother Nature associates. At this moment of shock, our brain makes like a camera, snap. And it stores itself all sense impressions as tracks, together with the Hummer focus, which will warn us in the future in a similar situation. If you just bit into an apple at the DHS, this results in an apple allergy. If you just drank milk, from now on, you have a milk allergy. If one has suffered a conflict with the boss, you will react allergically to the boss, from now on. If the conflict happened while driving a car, you are allergic to driving, and so on. However, the track is not something evil that Mother Nature wants to torture us with, but an early warning system, similar to a radar. If our subconscious recognizes such a track, we immediately have a conflict recurrence on all three levels, synchronously. Animals still notice these tracks. They notice the stress caused by them and therefore try to avoid these tracks. A dog that a particular person has kicked will avoid that person in the future. We humans, on the other hand, have lost all our instincts. We get a kick from the boss and run back to the boss the next day. Then we wonder why we are chronically ill. Everything that is chronic is running via these tracks. Whether you call it cancer, chronic illness, or allergy, it doesn't matter. The cause of the illness is the DHS, this conflictive moment. The rest of the disease is caused by the recurrences, caused by the tracks. The track is a part of the DHS. Tracks resolve not before the conflict will be resolved. If we cannot resolve the conflict, an attempt must be to avoid these tracks. Biological conflict shock also changes the nature of the individual. In the case of a man, a single loss of territory conflict is enough, and he can become gay. He says, wholly convinced of himself that his inclination comes from his innermost being. In reality, he only thinks that he thinks, and is thought by his conflicts. Without this loss of territory conflict, the gay man would not be gay. Apart from the obligatory compulsive thinking around the conflict, with the task of finding a solution to the problem, one can also become instantly psychotic. One can become manic or depressed from now on, until this very conflict is resolved again. The most striking psychoses are in the territorial area. A peculiarity of the territorial area constellations is that the conflict load stops. So, it stops cancer from happening on the organ, which can also be considered protection for the affected individual. Although the individual has several active conflicts, he can become ancient with them. Thus, the affected individual is psychologically conspicuous from this conflictive event, but on the organ level, he remains seemingly healthy. In the same way, a little girl can suffer a sexual conflict when she is confronted with the topic of sex for the first time, for example through a movie scene or in gender lessons. Due to this one moment of shock in childhood, she is later psychologically frigid as a woman, and cannot feel a vaginal orgasm at all. As a right-handed child with this one sexual conflict, she becomes masculinized and tomboyish. As a left-handed child, she becomes depressed and silent. The sensible biological special program, now starting with the DHS, is also nothing evil. Still, it helps causally, by a function amplification or function loss in the conflict active phase. If one was too slow to catch a morsel, the thyroid gland produces increased hormone and hyperthyroidism. Thus, the individual becomes faster in real terms and can now catch the morsel, and thus solve the cause of the hyperfunction. In the vast majority of special programs, the biological sense is immediately in the conflict active phase. Only with the so-called deluxe group, the connective tissue controlled by the cerebral medulla, the biological sense lies only at the end of the healing phases. However, this biological sense remains throughout life, whereas in the other SPSs, it is present only in the conflict active phase. A severe self-value collapse goes on the bone, which osteolysis in the conflict active phases. If this SDC is not resolved, the bone will fracture. In nature, this would be certain death as prey. In the healing phase, this bone is repaired under swelling, which causes this brutal pain. At the end of the healing phase, swelling goes down, but the bone remains thickened at this point for life. It's like when you break a bone. Once the fracture is healed, the fractured site remains thickened for life, so it can't happen as quickly. So, the biological sense in bone cancer is at the end of the healing phase. Dr. Hummer's findings show us that we should not fear the symptom, but rather the biological conflict and its tracks. With any therapy, one is always one step behind the patient. It would be wise to be one step ahead of the patient, by not allowing these civilization junk conflicts to occur in the first place. Germanische Heilkunde shows us the way into a new biological form of society, that would correspond to our humankind. In Germanische Heilkunde, the DHS is the pivotal point. From this cause, causal therapy must arrive. As long as one has not found the DHS, one is groping in the dark. The therapist must be able to find this DHS, together with the patient. If the therapist finds the conflict, then he is a good therapist. The therapist is a top therapist if he can give the patient wise advice on how to get out of his conflict. But the best therapist cannot live the patient's life. It is the patient himself who must put it into practice. It is also only the patient who can heal himself. The patient has to be aware of his essential role in his very personal matter. That is why it would be wise to have studied the Germanische Heilkunde in advance. Make Germanische Heilkunde your hobby. Until today, it says, one cannot prove all this at all. One person's life partner died, and he became ill. Good. But the other one's life partner also died, and he did not get sick. So, you can't say that conflicts necessarily make people sick. Wait a minute. It doesn't work that way, either. One person's partner died, and his world collapsed. The other one had a little help, so that his partner would die. In his case, the three aspects that make up a DHS were not fulfilled. One has a Hummer focus in the brain, the other does not. So, we can very well differentiate this. Conventional medicine denies the obvious. It is the other way around. Dr. Hummer has proven universally that the conflict is the cause. Now, it is up to conventional medicine to disprove this fact. One refutation would be enough. It has not succeeded to this day. Thus, Germanische Heilkunde considered being the state of the art of science. So, who is chickening out here is the conventional medicine. The church's hospital carrier, the media, the politicians, etc. They all do this at our expense and to our sorrow. Conventional medicine claims that cancer has multifactorial causes. If you ask the oncologist why you have breast cancer, he claims that this breast cancer is genetic. If you reply that neither your mother nor your grandmother had breast cancer, the oncologist wavers, saying it has other causes, such as diet or passive smoking. So multifactorial means nothing other than, if it's not that, then it's something else. That's like trying to nail a pudding to the wall. It just doesn't work. Professor Niemitz from the University of Leipzig explained that conventional medicine is an amorphous mush of hypotheses, and can neither be verified nor falsified. It has nothing to do with science. Concluding considerations. The iron rule of cancer thus describes the monocausal cause of diseases that arise by themselves. Hummer's focus on the brain is the proof of this assertion. Based on the knowledge of the cause of the disease, Germanische Heilkunde has developed a causal therapy with the declared goal of spontaneous healing. This therapy costs almost nothing and has no side effects. In comparison, conventional medicine does not know the cause of any disease in a reproducible way. Without tangible facts, conventional medicine is forced to resort to deceptive mathematical statistics, which can have no significance whatsoever for the individual. Since conventional medicine does not know the cause, it cannot treat the cause. At this point, we may note that alternative physicians as well neither know the causes, nor can they treat causally. Their methods are not as brutal as those of conventional medicine. That was it then. However, already again advantages relating to the school medicine. In Germanische Heilkunde, spontaneous healing is the declared goal. Spontaneous healing, by its very nature, has no undesirable side effects. A spontaneously healed patient is genuinely healthy and also retains his fertility. Conventional medicine cannot report this about its supposed success cases. Germanische Heilkunde is therefore not only correct in the scientific sense, but it is also exceedingly humane. It is us patients who finance this medical business with our social contributions. It is us patients who, with our signature, take responsibility for what the doctors do to our bodies. Who pays for the music also determines who will play music. We have the right to use Germanische Heilkunde for ourselves and our children at the next best clinic. Let us claim our right as responsible citizens. Thank you so much for being so attentive. Helmut Pilhar, father of Olivia.